Whether you're relaxing at home or out and about, make your music move with you. With Premium, you can download your music at higher quality, listen to songs ad-free, and play them in any order. Tap the banner to learn more. Whether you're relaxing at home or out and about, make your music move with you. With Premium, you can download your music at higher quality, listen to songs ad-free, and play them in any order. Tap the banner to learn more. Whether you're relaxing at home or out and about, make your music move with you. With Premium, you can download your music at higher quality, listen to songs ad-free, and play them in any order. Out and about, make your music move with you.
I can't tell you. Eh? So they should leave your dad and come here. Let's settle down. Settle down for the second scientific conference. Distinguished ladies and gentlemen, my name is Dr. Anthony Sabu. Welcome you to section 2 of presentation. We have presenters, Dr. Wala Otabidi, Dr. Sarah, Dr. Kachu, Dr. Onano Ida, and Dr. A.B. Orojo. So can the presenters come? Okay, the presenters, our IT session, are we ready? IT, are we ready? Hello. Please, the students should quickly take their seats. We are about to start. She's presenting. She's presenting. You are presenting. The presenter should stay on this line. Okay, Dr. Tan. Dr. Tan. So the first presentation will be delivered by okay, I want to introduce Dr. Ota session. Dr. Lila will be the first presenter. IT, please.
Good morning, everyone. Dr. Weiler, please, you have to come up now. Okay. The other, we're going to take it. So Dr. Weiler will start up. You have 7 minutes. We want to keep to time, please.
Dr. Tabebuki Waila is a consultant oral physician from UNTH. Okay. So I'll be presenting management protocol of official side effects of head and neck irradiation. It is important we share our experience in UNTH because UNTH happens to be one of the formidable centers where radiotherapy is done as of now. Okay. So these are the authors. Radiotherapy, as we already know, kills cancer cells, but there are official complications associated with head and neck cancers. All right. Now, a study that we did to assess studies in Africa showed these side effects: oral mucositis, xerostomia, and the likes. But these conditions, it's not just that they are conditions, but they affect the quality of life of these individuals if not managed or prevented. There are guidelines to actually manage these orofacial complications, but to a very large extent, it seems as if it's just, as far as Africa is concerned, it's just in the books. But have we started implementing it? One of such is the Max ISO guidelines. And of course, because of that, and we are in a center where this occurred, we decided to adapt this guideline to now make it peculiar to our setting, the UNTH. This study is actually a descriptive study where we x-ray the protocol using a design flowchart. The protocol is this. They are divided into 3 phases. Every patient that should come for radiotherapy for head and neck now must pass through oral medicine clinic. It is now a standard, and I want to say at this juncture that our center happens to be, for now, the only center where this has been well implemented. And so that is why I'm here to spread the news, because I know that UBTH is now a center of excellence for radiotherapy. And I'm very, very happy, particularly because I'm standing before the CMD to talk about this. All right. So we have the pre-radiotherapy evaluation, intra-radiotherapy, and post-radiotherapy. Now, this is a flow chart that my colleagues and I will now design. This is the specific thing that is happening now. Now, if you look at it properly, there are referrals from all centers, and they come to the radio oncology. Now, these people will have to go through oral medicine. They are sent to oral medicine before they start the radiotherapy. Nobody goes through head and neck radiotherapy as of now without having to go through oral medicine. And that has increased our patient output. And again, it has led to revenue generation, because every patient that comes must pay a certain amount. They pay 25,000 naira in our place. It's cheap, but I think this center will have to determine theirs, because they go through that period for about 35 sessions. That is about 7 weeks. For oral medicine, if there is need for debulking, we have to send them to maxillofacial surgery. That's where the issue of advocacy comes in. We are like playing the devil's advocate. If they are not fit for radiotherapy, we tell them, go to oral surgery, they do the debulking before they go back. Now, there are also some that have referrals from chemotherapy, because sometimes there is concurrent chemotherapy and radiotherapy. If they are determined fit, we move them to oral medicine to now start the intra-radiotherapy treatment, because all the complications, they happen within the therapy session. And when the radiotherapy session is completed, we send them back to oncology, and they will now be triangulating between oral medicine and oncology for follow-up. So the pre-radiotherapy, intra-radiotherapy, and post-radiotherapy, they are well represented here. Now, what are the things we do pre-radiotherapy? They are stipulated here. Now, I want to point out here that emotional and psychological support offered by the oral physician is very key, because most times, as they are coming for the radiotherapy, they don't even tell them what to expect. We do that because, you know, there's an adage that says that the stone that one sees does not blind the person. Dietary counseling is key, because they will need to eat at this time. So this is an assessment at pre-radiotherapy of a patient that is about to undergo radiotherapy. So because of the extraction that needs to be done, we had to do some gross scaling, then the extractions have been done. This is very important, because you want to prevent the most feared complication of radiotherapy, which is what? Osteoradionecrosis. It's an issue you don't even want your enemies to have post-radiotherapy. Now, we have a proformer. Apart from just treating patients, we also do research. These are proformers for our research and stuff. So every complication, they are exemplified here. Anybody that wants, you want to collaborate, I can always avail you of this. Now, the intra-radiotherapy, they visit us twice daily, twice weekly, and we put them through on so many things. But I want to also state here that because this is an emerging area in oral medicine and dentistry generally, I want us to know that it's very challenging getting most of these drugs. That's one of the challenges, and that's an experience I want to share. So because of that, we try as much as possible to work with the compounding pharmacy in order to be able to compound some drugs ourselves. Now, this is a case of oral mucositis intra. This lady underwent maxillectomy, as you can see from the other slide. So, but this actually complicates the oral mucositis. But by and large, at the end of it, this woman is just about to finish her 35 session, and that's a huge success for us. This is dermatitis, the same woman, just to exemplify. Now, there are some of these drugs that we use, many of which we have now sourced ourselves. For example, there is this new one that I decided to compound with the compounding pharmacy, castor oil, benzocaine, clotrimazole. This has been working magic for me. It has no name yet. I'm hoping I call it the magic paste with time. All right, so to look at some results, we looked at the patients that have come to radiotherapy themselves since last year, July, 206. But we have still not been able to harness all of them. So the tumors, I want to make sure here that it's not just orofacial tumor per se. People with head and neck tumors, brain tumors, and all that, they also come because they must go through radiotherapy. It's not just about maxillofacial. So I want us to take note of that. Now, this is our success so far. We are hitting 52.4 for now. Before now, it was 0. Now, it is 52.4. The engagement is still ongoing because it is not easy to engage with the radio-oncology for you to have all their patients. It takes, zest and strong collaboration. And I know that this center will do far better than me. You know why? Because I learned everything I'm doing there. I learned it from here. I want to mention this. It's a unique case. Why? This is an example of someone who did not go through the protocol. He just went to radiotherapy and they radiated because they did not come to us. After radiation, of course, they came to us. We were managing the complications intra because they came when they were already doing it. There was nothing we could do. This patient could have benefited from debulking first. That's why that principle is very, very important. But for now, we just have to watch and see because the surgeons wouldn't want to touch this jaw anymore because it has already gone through a phase of radiation. I want to conclude here by saying that this is just my experience. Work is still ongoing, researches are still ongoing, collaborations, they are very, very important. But I want us to have it at the back of our mind that as we are bringing radiotherapy here in UNTA, it's a UBTH, it's a new horizon, and it's the beginning of an area in dentistry that you cannot even quantify. Every specialty, they have a role to play in the management of not just the cancer, but the complications of the treatment of cancer, which is radiotherapy in this case. I know you will do well in this regard because you have always taught me to raise the bar. I know this is to raise the bar. Thank you. Next. There's something. Next. Just one or two slides remaining. I just wanted to say something. Press it now. All right. Actually, what is on the other page, an acknowledgement to my teacher, Professor Oko, Professor Morigi, and the first person that started doing this work on that. That's what I wanted to say. Thank you.
Thank you very much. All questions shall be reserved till the end of the presentation. So you can your questions now take up later. So the next presenter will be. Thank you.
Good morning, CMD and Chairman. Good morning, everyone. My name is Dr. Okebo, Consultant Oral Medicine, EBTH, and all physicians are doing great things. Dr. While I can assure you that we are working with the chemotherapy team already in UBTH, and now with radiotherapy, we are going to strengthen our collaboration. Okay, this someone will be giving us a study on association between refractory trigeminal neuralgia and hypertension in UBTH. Okay. So we all know trigeminal neuralgia is a very painful disorder, electric shock-like pains, abrupt onset and termination, and the treatment is mainly medical, carbamazepine. And most of our patients respond very well to this. However, we began to see some cases whereby they've been taking these drugs and they're not responding well. That is why we have the term refractory trigeminal neuralgia. So when patients have this condition whereby they are taking the drugs and not having good pain relief, it's quite depressing, even for them and for us, the physicians. We even had a patient who had to take sniper and say he just wanted to end his life. He was tired of living with that level of pain and nothing was working. He was taking the drugs quite well, but it wasn't relieving his pain. So what are some of the causes of this refractory TN? Drug tolerance, drug interactions, fake drugs, some even cold weather, stressful conditions, comorbidity. So these things can cause refractory pain of TN. We also have a theory that says that hypertension is a risk factor for refractory trigeminal neuralgia. It says that when there's high blood pressure, it can lead to vascular loops compressing the trigeminal nerve, and so the patient will keep coming down with this pain. Sadly, very little information exists in literatures regarding the pain of trigeminal neuralgia and hypertension. However, in our medicine clinic, when we began to see that most of our patients that we're managing, they were coming to us with no relief despite all efforts, we said, well, let's look into this. What could be happening? So having ruled out all possible causes of this refractory pain, one thing we found common in all our patients was poorly controlled blood pressure. For most of these patients, what they just felt, oh, what's the link? I'm having pain in my face and you're telling me my BP should be checked. So they're not taking their blood pressure control seriously. So we decided to do a study to see the association between this refractory pain and patients' blood pressure. So this was a prospective study done between January 2024 and December 2024 for all patients being managed for TN. And so the ones that were diagnosed with refractory TN were referred to the cardiologist for proper control of their blood pressure, and we monitored them in the oral medicine clinic. We took their vitals, the blood pressure, and their pain levels, 2-week and 4-week intervals, and these values were documented. So the result, in that year, 2024, January to December of that year, we had 25 cases of trigeminal neuralgia seen in our clinic. But of these 25 cases, 12 of them, 6 males and 6 females, reported with refractory pain, even with their medications. And that's the age range. The average age was 54 plus 9.1. The left side of the face was mostly affected, with the mandibular division being more implicated. So just as I said earlier, okay, left side more affected, mandibular division more affected. Now this is very important, this table here. So we looked at these patients, the pain scores at presentation, T1 and T2, that's 2-week intervals, T2 to 4-week interval, when they were taking their blood pressure medications properly. So you can see that the average pain level at that time on T1 was 8. Then at 2-week intervals, it dropped to 5.5. There at 4 weeks interval, it dropped to 3.5. Now look at our blood pressure. The systolic upon presentation, the median was 161.5, diastolic was 100. At a 2 week intervals, you can see the drop. The systolic dropped to 148 and 86.5 for the diastolic. At the fourth visit, the systolic had also dropped further to 136 and diastolic 81.5. So you can see that when they were following managing their blood pressure properly, their pain level was going down, and the systolic and diastolic were also going down very well. So the same thing, just trying to compare T0 with T1 and T2. So this study observed that refractory TN had no gender predilection, indicating that gender may not be a risk factor for development of refractory trigeminal neuralgia. All our patients had pre-existing hypertension, and they were very compliant with their carbamazepine control intake. However, their blood pressure control was a problem, so they kept on having this refractory pain, which was not remitting at all. And this gave this credence to the theory that says that hypertension is a risk factor for the clinical signs of TN. So upon institution of the blood pressure control by the cardiologist, we found out that the patient's refractory pain remitted. It began to drop. So we had to start counseling them. That is not enough to just take your carbamazepine. You must control your blood pressure too. So on follow-up of this patient, upon follow-up of this patient, but we're still following them up. So anytime their blood pressure spikes, anytime they are not managing their blood pressure, they will always come down with this refractory pain. So this study is to educate the populace, our colleagues outside, even those in private practice. It's not enough to just give them their medication. You must look at for reason why they are not having remitting pain, and especially their blood pressure. People do not seem to link them, but it's very important. If your patient is having remitting pain of TN, please do not be in a hurry to combine medications, change medications. Look at their blood pressure control, because right now we have proven to the academic world that blood pressure control is very, very important in managing trigeminal neuralgia. Thank you very much.
Thank you very much, Dr. Kwekor, for that. Thank you for keeping to time. The next presentation will be taken by, on behalf of, it's a presentation submitted by Dr. Kwekor Sagai, and you'll be taking it. So you have 7 minutes, please.
Good afternoon, Chief Medical Director, Dean of Dentistry, professors, consultants, my trainers, my colleague, and my junior colleague. I am standing here this morning to present a topic on behalf of my consultant, Dr. Kwekor Sagai. I am presently an intern dentist with the Edo Specialist Hospital, Benin. So the topic is pre-hospital self-treating of orofacial swelling. Observe the clinical presentations of patients. Okay, as a way of introduction, we understand that orofacial swellings are actually signs and symptoms following odontogenic and non-odontogenic infection. So the aim of this study is we want to see what patients always do before they present to the hospital and how they have always managed the swelling on their own. So we notice that jaw swellings are common complaints of odontogenic infection. And in our environment, self-medication is common, and this is very paramount for every patient, both dental and non-dental patients. So the objective was to assess the type of self-treatment, and then we observe the clinical presentations of these patients. So it's more like an observational study. The population were drawn from patients who came to the clinic from 2015 2015 to 2025, there were no exclusions. So we worked with the pharmacological and non-pharmacological intervention. For the purpose of this study, warm saline mouth bath was regarded as a pharmacological indication because usually prescribed by the dentist. So we collected our data using Excel spreadsheet, analyzed, and was presented graphically and visually. So the total number of respondents or cases for this study were 131, comprising 52 males and 79 females. We have always known that females have the aptness of coming to the clinic more than males. So for odontogenic infection, we have 104 cases, and for non-odontogenic, we have 27. So these are the age and number of patients who came to the clinic with facial swelling. We could see from the chart that about around the age of 20 has the highest number of patients who came to the clinic with facial swelling. So these are the interventions that was instituted by the patient. We have pharmacological intervention, non-pharmacological, and combined intervention. Now, we want to take a deeper look into what was done in the pharmacological indication. The number of days, at what time did the patient instituted their management for the swelling? So we have days, weeks, months, and even years. So for day one, it showed that several patients used some pharmacological intervention, which we'll talk more later. For day 2, 11 patients did that. For day 3, 13 patients, and just like that. So for non-pharmacological indication, we noticed that for day 1, 8 patients on noticing the swelling, they did some form of therapy that we have categorized as non-pharmacological. Probably maybe they added, they rubbed it with anointing oil, shea butter, and some water of nuts. Then for the intervention, this is for the pharmacological, those that used monotherapy were 47. Then those with polytherapy was 25. Then for the non-pharmacological, those that used more than one non-pharmacological means was 50, were 50, and those that used just one were 59. So what are the pharmacological agents that these patients used? Some used tablets, capsules, syrups, injections, and salt solutions. So these are the type of pharmacological interventions that were used. From 26% or thereabouts used antibiotics, about 16% used warm saline mouth bath, 2% used tablets, 31 analgesics, steroids, injection, syrup, medications, drugs, and vitamins. For the modes of usage, we have the oral, topical, intramuscular, and the rinse. So these are the non-pharmacological interventions that some of the patients used. We have herbs, some made incision, some used tobacco, some used shea butter, anointing oil, balm, alcohol, some used some removed the swelling, some used fear, some used tooth powder, battery, acid, spirit, touch and go, alligator pepper, potash, anything. So applications of non-pharmacological treatment. So we have those that we have rinses, which could be herbal, fear, alcohol, touch and go, battery acid, lime, potash. For the toothpaste, some use tooth powder, some use light products. For the massage, we have balm, shea butter, anointing oil, palm oil. Some chewed and spat out tobacco or alligator pepper. Some removed worms using worm removal solution. Some made incisions to remove the pus and discarification, and some use hot water therapy. Clinical observation: extraoral swelling was about 38%. Intraoral white lesion, probably from the use of aspirin. Intraoral swelling, extraoral ulcers too were noticed. Discussions: patients have been known to treat odontogenic infection before presenting with facial swelling. Non-pharmacological treatment is common in developing countries. In a country where you can actually get any medications out of the counter, we will not expect something to be very different. So monotherapy is application of hot water with towel to apply over the lesion. This usually cause vasodilation, increase blood flow, and can cause increase in the size of the tumor. So some also use methanol balm with the same effort. So as a way of conclusion, odontogenic infection are responsible for the majority of head and neck swellings. First response by the patient is use of non-prescribed intervention. Non-pharmacological intervention is commonly used. Non-resolution of swelling and increased size brings patient to the clinic. Damage to the tissue can result from overzealous use of different form of treatment by the patient. Thank you.
Thank you very much. The next presentation will be taken by Dr. Kachina Wihe. Please, you have 7 minutes.
Yes. With the esteemed teachers, trainers here, colleagues, senior colleagues present, I'll be presenting the basic package of oral healthcare meets the oral treatment needs of prisoners in Nigeria, pilot study of inmates in the Nigerian Custodial Center. These are the authors from the Intercountry Center. So the basic package of oral care, that's BPOC, is a composite care that consists of easy access to fluoride, simple preventive restoration, emergency oral care services mainly for the relief of pain, control of infections, and was designed to enhance penetration of oral health care in resource limited settings, and Nigeria is one. So these are the components. The fifth component, as advocated by the Association of Dental Practitioners of Nigeria Association, includes scaling and polishing. So prisoners deserve access to care like the general population. However, the near lack of oral healthcare services in Nigerian prisons makes this population a severely underserved one. Furthermore, there is little information on the oral health of this group for protection and promotion activities. So the objectives of the study were as to evaluate the oral self-care practices and their use to fluoride, assess the oral mobility and determine the adequacy of BPOC to taking care of these events. So we saw 282 inmates, and the males were 260 of the population, and the age range from 80 to 78 years. Access to fluoride, we had only 23 who brushed once daily with a fluoride containing toothpaste. These are shown in the table. Access to fluoride whereby 108 of them had access to fluoride, and of this number, only 23 were able to brush daily. Oral pain was the major driver to presentations to a temporary oral health service center set up in the Jos Correctional Prison, and followed by swelling, bleeding clots, injury inside the mouth. Significant clinical diagnoses that were elicited from the inmates were chronic gingivitis, about 39% of the whole lot, dentovelar abscess, 18.4%. This is as shown by the graph. The figure funnel diagram. All right. Concerning the patients, we were able to manage 279 of them. We only had to refer 3 for further treatment. We carried out 404 oral healthcare procedures, and these were outlined: oral health counseling, atraumatic restorative treatment, dental extractions, and the rest of them. And of all this, 98.4% of all the procedures we carried out were components of the basic package of oral care. So about a third of the participants had access to fluoride, toothpaste, and brush. This is comparable to prior studies in this field and also reflects poor assets. Oral self-care hygiene was inadequate as less than one-tenth of the sample population had access to fluoride and they could brush once daily. All right. Circumstances surrounding their stay, including oral health awareness, might be reason that we have sought for this. Majority of the complaints were driven by complaints of pain, ulceration, and this may be linked to neglect, oral health neglect by due to poor access to oral health care services. In addition, the unsatisfactory nutrition, psychological stress associated for being confined in a space may also be attributable factors. Over a quarter of the dental caries noted have progressed to sequelae. This suggests a high burden of untreated diseases. Reasons for the clinical diagnosis, as observed, were also reasons driving these complaints of uptake. And nearly all participants were managed by the basic package of oral care as advocated by the Association of Dental Public Health Practitioners of Nigeria. So BPOC is really a good fit to be introduced as an early form of oral healthcare services in the Nigerian correctional prison system. It's also cost effective and ideal in resource-scarce settings like Nigeria. Furthermore, it promotes the principles of primary health care, especially its focus on prevention, sustainable and appropriate technology.
participants, physicians and all, to be part of that. It is not only when we are doing research work or collecting data for part 2 that you should be interested in such things. It should come for the passion we have for such patients, and that's what I would encourage all of us. Now, the issue of, and I'm quite glad to talk about survivorship. Certainly, cancer is all about survivorship. Without that, you really are not doing anything for them, and that's what we try to do over there. The second one is more the refractory trigeminal neuralgia. I thought with the refractory trigeminal neuralgia, we should actually go deeper in assessing such patients. There will be no harm doing a CT for such patients. And this is something I have noticed personally. We just managed the case, the patient who had been managed for trigeminal neuralgia for about a year. And when he presented again, we need to look deeper. We saw that the tumor in the sphenopalatine region, which had extended into the base of the skull, and in the parapharyngeal area. And that patient has been operated and is doing well in the world right now. So I think we should also extend, especially when it's refractory, we can go further and investigate such patients, because they really things trigeminal neuralgia represents the traditional way, but we know things like multiple sclerosis, temporal arteritis can actually make diagnosis difficult. So we could use that opportunity to look deeper in such patients. And trusted love, just a comment, trusted loved ones. How can you trust somebody and your lip is beating? Thank you.
Thank you, sir.
Good morning, my colleagues. I'm Dr. Arun, the Chief Medical Officer, Assistant from Kinetic. I want to correct one correction, because this is an international conference for School of Dentistry. And to the best of my knowledge and to the best of what I know, because it's very well for us to take this notion that this research study carried out, and there is no ethical clearance. And this is the focal point of UBTH, and I think it said UBTH and about SFFC. So you cannot do a research that is involving human beings without ethical clearance. Except I stand corrected in this gathering. That is a new trend in UBTH or in trend in Nigeria now, where you can do the research without an ethical clearance. I don't know if anybody have a contrary opinion about that. You cannot do a research that involves human beings without any ethical clearance. Thank you.
Thank you very much.
Question for the first and the last presenter. I don't know whether your center, whether you have done post-mortem or how many of them actually came back with micrometastasis. Because micrometastasis is one of the major challenges in cancer management. And that was the major challenge to suffer like that from pancreatic cancer. Those who carry the data that I need to be 100 years, into the fact that I do go for surgery, went for checkpoint inhibitors. That's one. Post-mortem. And two, I don't know too whether you give them some level of stress of management. Level of stress of management. Do you want to be therapy? Do you want chemo? Do you want immunomodulators? Do you give them that kind of robust choice? Or do they do some form of other advanced testing? Like genetic Then for the last one, the lead by product. Well, I said, I think anger is just the best thing. You refer them to, although we don't have them yet, we have a section for counseling for anger. Because it's a major issue. It's not just anger, domestic violence is very common. And we take anger management for granted. And it is high time we inculcate more anger management in our country. It's a very, very big issue in the developed country, anger management. So I want to know whether there are cases where they have to see whether they can give us some more counseling on anger management. Thank you very much.
One last question by Professor. And we round up the session. Thank you very much.
Thank you very much. Thank you, Dr. Wella, for your presentation. I was just thinking that with your work, have you people been able to release a policy statement in your hospital so that if the radiotherapy people now manages head and neck cancer without coming to oral medicine, the amount to negligence, so that affects the work for the government. I was wondering, could it not have been that we have measured the plasma level of those that have a refractory to be sure that their metabolic rate or other activities is not what declining it, that is not optimal. And I get challenged if I'm taking drug for trigeminal neuralgia and I'm consistent in taking it, why could I not be consistent in managing my blood pressure? That was actually my challenge. Is it that your patient is through counseling from the time of diagnosis and making them to fluctuate between getting control of their BP and taking the drug? Because is it not that they are not good at taking drugs?
Thank you very much. I am really very sorry that this session will have to end. Our guests are here, and I really want to thank all presenters for showing and sharing their works with us. And from the comments and questions, and we also know that those works will be polished and made available in reputable journals for further studies. I thank you all for attending and for listening. Thank you.
Let's put our hands together for Dr. Anthony Osagwana and Dr. Ofasarwe for coordinating that session very well. Thank you so much, sir. Thank you so much. Wow. We're going right away to the opening ceremony for formalities. And I want, on behalf of the Dean of Dentistry, make welcome every single one person here in this auditorium. Most especially our chairman and representative of the Vice Chancellor and all other guests that have made their presence here on time. We really appreciate it. We do not take it for granted. So if you look through your brochure, the very fine one in front of you, we're going to be welcoming guests to the high table very quickly. And after that, we'll take the opening prayers and we'll go on with the national anthem. So my name is Dr. David Orewe, Senior Registrar, Department of Family Dentistry, University of Benin Teaching Hospital, and I'll be handling complex duties for this morning. Please, you do well to just put your hands together as I invite. You do well to put your hands together as I invite the various dignitaries that will constitute the high table. So we're constituting the high table right away. I want to welcome the Vice Chancellor of the University of Benin, Professor Odoba Bright from Morgan Senior Advocate of Nigeria, here represented by the Deputy
Chancellor Administration, Professor Christopher Osugo. Welcome, sir. Let's put our hands together till he gets here. Thank you, sir. And to sit at his right hand till the enemies become his footstool. Professor Wilson Sadu, the Previous College of Medical Sciences, University of Benin. Thank you, sir. Thank you, Provost. So come over to the high table right away. I want to invite, if she's ready, the Dean of Dentistry. Okay. The Dean of Dentistry. Thank you for clapping for the Dean of Dentistry. Please clap again for the Dean of Dentistry. And incoming CMD of UBTH. Celebrate you, man. We cannot stop celebrating you. No, we cannot stop. Yes, you're here, man. Thank you so much, man. Let's celebrate the Dean of Dentistry. Looking very resplendent, looking beautiful as always. Thank you, man. Professor Ija Niboko is there. Welcome, man. We have the Commissioner of Women Affairs as a special guest here. The Commissioner of Women Affairs is here represented by the Permanent Secretary, Ministry of Women Affairs of those states, Mrs. Irenose Ihensekian, to sit beside the Dean of Dentistry. Welcome, man. I wait the Chief Medical Director outgoing of UBTH, but while we wait for him, we want to welcome very specially the Chairman Medical Advisory Committee, CMAC UBTH, Professor Stanley Okube, to the high table. Professor Stanley Okube to the high table to sit beside the BC representative. Thank you, sir. And then I want to invite our keynote speakers to also join me. That's fine. To welcome also to the high table, please let's put our hands together as we receive the Deputy Chairman Medical Advisory Committee, DCMAC Training and Monitoring, Dr. Fidelis Eki Ibuko, to the high table. To sit beside the CMAC. And the final two to make the high table this morning will be our keynote speakers. Our keynote speakers. The first being Professor Christopher Okusei, our first keynote speaker. Let's put our hands together to come to the high table. Interesting to note, like I mentioned yesterday, that at the first annual scientific conference in 2012. So Christopher Okunso was one of the speakers. Let's put our hands together for him. He's here many years later. Thank you, sir, for honoring our invitation. The final cut for the last and by no means the least, second keynote speaker is the indefatigable professor of community dentistry, PhD community dentistry, UTH, a trainer of trainers, Professor Sonny Okigome. Welcome, sir. All right, I'm not handling this duty alone after all. I have a co-anchor, Ehisuma Olamata, who's joined me up. If the DJ is ready, we're going to the national anthem right away. Shall we see God
I'm honored to welcome you.
Take one, two.
All right. Good morning once again. I'm honored to welcome you to this August gathering. My name again is Ehisume Iriamiatore. Thank you, Dr. Dave, for that introduction. I'd like to specially welcome everyone and to do this together and to assure that this event is going to be a memorable one for every one of us. Dr. Dave, I think we'll call the next item for the program.
So we request that Dr. Philip Ogodi stands by. But before that, we want to quickly recognize some special guests that are with us. We have in our midst as well a distinguished and accomplished dentist. We call him the #1 dentist in government. No other person than the permanent secretary of the Ministry of Health. We're going to invite him to join the high table. Dr. Stanley, we welcome you, sir. Please let's put our hands together for him as he comes to join us on the high table. Thank you, sir. The introduction of guests is by no means going to be exhaustive with this, but I want to quickly acknowledge some of our trainers and teachers that are here. We have we start from former deans. There are a lot of former deans that are around. And no better place to start than the dean who started or who kick-started the Alumni Scientific Conference way back in 2012. Can we clap for her before I call her? Thank you. So the first alumni, scientific conference was held on the 2nd of August 2012. Dr. Anthony Sagona was the LOC chairman. And, that was during the deanship of the first female dean, School of Dentistry, and anywhere else in England. I was told that yesterday. Professor Mrs. Alice Owen. Let's celebrate her this morning.
Thank you for coming around, ma. It's nice to see you again, ma.
Welcome, ma. We also have here a former dean of the School of Dentistry, distinguished professor and consultant, Professor Matthew Sebo. Please let's appreciate him this morning. We have in our midst as well the coordinator, Dental Complex, University of Benin Teaching Hospital. We are reliably informed that she is the only oral medicine specialist in South Nigeria. The only professor. Female. The only professor. Okay, no, we actually have another consultant oral medicine specialist, but she's the only female professor of oral medicine in South Nigeria. Professor Mercy Oko, you're welcome, ma'am.
Welcome.
We have in our midst another distinguished female, since we're following that part already. The only female professor and consultant postodontist. Yeah. Professor Julie Omo, you're welcome, ma'am. Professor postodontist.
I guess it's female o'clock.
It's female o'clock. And we're moving to the next one. Our madam. This one we call her our madam because if she say we should place this program, we'll place it. That happens. Well, chairperson of the Nigerian Dental Association of those State, first female, consultant restorative dentist, Professor Joan and Abuli, welcome, ma'am.
This is beautiful.
We have one of our very fresh professors here. Oral and maxillofacial surgery, Professor Emeka Odai, JP. consultant oral and maxillofacial surgeon, head of department, oral and maxillofacial surgery, Univen UBTH. Professor of Periodontology, Professor Adebola Ehizele. Let's welcome her this morning. Professor of Periodontology, Professor Clement Azodo. Let's welcome him this morning. Our immediate past dean and chairman of the board of the Univen Health Center, Professor of Oral Pathology, Professor Osawe Felix Omorige. And if I will add, the brother to the visit. We also want to very respectfully welcome the director, she's just walking in, the director of the Institute of Child Health in the College of Medical Sciences, University of Benin, Professor Mrs. Ayebo Sado. You're welcome, ma'am. Yes, she's the wife of our provost. We're going to welcome as well the pioneer director of the Center for Forensic Studies, University of Benin, Professor Eddie Kamela. You're welcome, sir. Very accomplished dentist by all standards. We have here with us also the head of the Department of Mental Health. He is a very good partner with us in dentistry. He has written a lot of papers with several of our colleagues here in dentistry, and he always identifies with us. So, Higiato Adanyofo, you're welcome, sir. Permit me to very quickly acknowledge the head of Department of Pediatric Dentistry, Dr. Neka Chukuma, Associate Professor. We have Dr. Edetanla EA with us as well. You're welcome, sir. And we will make very many more acknowledgements as the program goes on, but we have to go right away. We have also, so that I don't offend the powers that be. Today is her birthday, and we'll celebrate her. Madam Prudenza Worldwide. Prudenza is Benin University Dental School Alumni Association Worldwide. President, or is it our chairman now? President Ma. Dr. Ngozi Edogu. I don't know where she's seated. Yes, welcome, ma. Welcome, ma. Sing the happy birthday song later.
All right, we can say for a fact that we have able personalities here in the room. I'd like to now specially acknowledge and recognize the presence of students of the School Dentistry, University of Benin. Yes, your participation in this conference is highly appreciated. God bless you. Without wasting much time, I'd like to bring to the microphone for his welcome address the Chairman, Local Organizing Committee. I'm talking of no other, Dr. Philip Ogodi. Can we welcome him?
Thank you very much. I'm going to stand on the ready established protocols. I'm very delighted to welcome you all to the lecture series, the scientific conference of our school. This year's conference is aimed at ensuring oral health in Africa, as well as projecting dentistry outside the four walls of the clinic into the community. Children doing for this conference is oral health in Africa, state of affairs, emerging trends, and future prospects. So we delivered by another scholar with a distinguished personality, the gentleman to the core of the Christopher Okusere, a renowned professor of dental public health, dentistry, Market University, Wisconsin United States. subject for this conference is community dentistry, public health service development country, to be delivered by our very own alumnus, the distinguished gentleman, Professor of Community Dentistry, Professor Sonny Kogome. The currently selected alumni lecture theme focus on the most misunderstood yet essential aspect of dental practice, which is dentists who want to engage to make practice accessible in the area of insurance. The topic is how this might ahead, navigating dental insurance together. Delivered by our alumnus, Dr. Christos Efe. Very proud of. Sincere appreciation goes to the Vice Chancellor, Professor for providing the fertile soil in which we are currently thriving in academics and research. Also go to our CMD, Professor Obaseki, who has been a pillar of support to all our programs. All heart appreciation goes to the chief host of this conference, the Provost of Medical Sciences, Professor Wilson Sabo, and host, our very innovative and exceptional being of dentistry, Professor Ilya Nobuku Izayama, and all board members and staff of our school. With heart full of joy, I want to sincerely appreciate those who believe in us and supported us in this measure. And this is our landmark here in our lecture series, from Dr. Afizobu through to Dr. Ese Anita Okuyayi, our professors, Dr. Ida Okuyayi, through to Professor Alice Oweni. And those that collaborate with us, supported us, send people messages every time we are being served worldwide, and the sets as well that supported us. We thank those who that supported us. We appreciate the clinics, the brands, and the people that send their good messages. I want to thank my staff and LOC members for their cooperation. Not forget the previous LOC members, on which are trying now to improve on. This year's conference promises to be exciting and also interesting, over educating. So sit back, relax, and enjoy this conference. Once again, you are much welcome. Thank you very much.
Thank you very much, Dr. Ogadi. We now have the privilege to invite to the microphone for her address the host of this event and the latest CMD of UPTH. I'm talking of Professor Yami.
The Vice Chancellor, sir, ably represented by the Deputy Vice Chancellor, Admin, Professor Christopher Osumwa, my Provost, Professor Wilson Sado, CMAC, University of Benin Teaching Hospital, Professor Stanley Okubo, DCMAC Training, Professor Ekidoko, PS, Ministry of Health, Dr. Stanley Ehiarinwa, PS, Women Affairs Commission, who is representing the Honorable Commissioner of Women Affairs, Honorable PC Daomi, but PS is standing in for her. Mrs. Irenose Ihensenke, to all my colleagues, past deans, HODs, professors, friends, colleagues, students, and everyone that has come to be with us today. I welcome you all to this triple program of the School of Dentistry, namely the Distinguished Lecture Series, the Annual Scientific Conference, and the Alumni Reunion Series. These were instituted 10 and 14 years ago, respectively. The aim was to enlighten the immediate and extended community about dentistry and also encourage intellectual discourse amongst professionals from all the specialties in dentistry. The theme of this year's conference was carefully chosen to embrace the community and is titled Oral Health in Africa, the State of Affairs, Emerging Trends and Future Perspectives, and will be given by distinguished alumnus, Professor Christopher Okuseri of Marquette University in the United States of America. I want to especially thank and appreciate Professor Okuseri. He has been a friend of the dental profession. He has been a colleague. He has been a great supporter. and he has been very instrumental, very instrumental in giving back to his alma mater. As I sat beside him just now, he's giving so much. You know, there are so many things you don't want to say, but you are just posting on the inside because you want to say it, because he's always giving us things, and he has given us something that is going to shake the whole of the university community. Yes, he's giving us something that will shake the whole university community. And once it arrives, the total worth of what he's giving us is approximately 500 million naira. And while I sat here with him just before we moved up to the high table, he still gave again. So please, let's appreciate him. He has told us that, permit me, sir, I can't keep it in. He has told us that he's the editor of an international journal of dentistry in the United States, and that one of the best poster or presented papers should be sent for publication in that journal free of charge. So we're already getting international exposure courtesy of our keynote speaker. The sub-theme will be given by Professor Sonny Okegbeme, titled Community Dentistry, Public Health Services in a Developing Country, and he's the current head of the Department of Community Dental Health. This year's program, which is my very first as the current dean of the School of Dentistry, started yesterday, the 13th of August, with the commissioning of a renovated and fully equipped dental clinic in the university's health center complex, a landmark project to commemorate the 10th edition of the Distinguished Public Lecture Series, and was done in collaboration with a notable alumnus and graciously named after her late husband, Dr. Victor Obiageli, who was a renowned dental surgeon in Edo State. This project, while being capital intensive, will serve a direct need to the staff, students, and community of the university concerning their dental needs. Alumni play a very important role in their alma mater, and this is exemplified by this project. I am optimistic that this alumni reunion of this year 2025, and especially tomorrow, will take this as a challenge to engage with the School of Dentistry in a needs assessment and identify landmark projects for expansion, quality teaching, training, and mentorship as part of their corporate social responsibility and giving back. In my 6-month stewardship as a dean, alumni have assisted the school in the acquisition of equipment, provision of an 18-seater air-conditioned Toyota Hiace bus, dental loops, rotary endodontic handpieces, mobile dental units. Permits me to say again, please let's give another hand of applause to Professor Christopher Okuseri. Just yesterday, he also donated 2 mobile units and complete accessories for dental outreaches. Professor Okuseri, we are so grateful to you for all that you do. These mobile dental units that he has given to us will be domiciled in the office of the Dean School of Dentistry. We also had books, journals, computer training of non-academic staff, renovations of the School of Dentistry transcript room, renovation of the Bodsa office and students' classroom, and many, many other things that have been done by alumni. We also have non-alumni also contributing as part of their own CSRs to the University of Benin. So as part of the school CSR, we gave back to the academic community by carrying out a free oral health outreach and treatment program at the Faculty of Law yesterday. Oral health education, fasting and random blood sugar check, blood pressure check, screening for oral diseases, free scaling and polishing, simple extractions, and then more difficult cases were referred to our newly commissioned dental clinic in the health center complex. I'm grateful to our volunteers, donors, sponsors, and students. Students, thank you so much for all you do. You were there in large numbers, even until late last night, working together as a team to make it successful. Research plays a large and major role in any university, and funding is a major challenge as quality research is hinged on it. To inculcate a culture of research, prizes have been instituted for research, diligence, and specialty in this year's annual conference, in our annual conferences, namely the Professor Obo Prize for both undergraduate and postgraduate research, with a prize award of $100, and the MBA award for the best case report in dentistry with a prize of 100,000 naira. However, this year, 2025, we introduced two additional awards, namely Professor Izayamu's award for the best case report on research in orthodontics, with a prize of the cash prize of 100,000 naira and a certificate, and the Professor Patrick Ojehano award for the most dutiful clinician with a cash prize of $200. Looking forward to robust and engaging research, and we are eager to identify with those researchers who would win these prizes. As we begin this year's conference, we believe we will break new ground in mentorship, friendship, training, and research. Thankfully, we have not missed any edition, and we are currently a scientific conference and the 10th in the public lecture series. We are extremely grateful to the general public, friends, well-wishers, associates, academic and non-academic staff, the LOC led by Dr. Philip Ogodi, an associate professor of orthodontics, who together with his hard-working team have worked tirelessly to coordinate and put it all together. We are extremely grateful to our innovating, hard-working, and supportive Vice Chancellor, the first alumnus to be the VC of Uniben, Professor Edoba B. Omorige, SAN, for his listening ear, open door policy, and encouragement. To all our alumni and friends here and in diaspora, I say a big, big, big thank you. As we engage, evolve, empower, and elevate ourselves through this conference, we hope that great ideas and progress for the School of Dentistry, University of Benin will be articulated and showcased to place us amongst the best dental schools in Nigeria and beyond. I welcome you all, say enjoy the program, thank you, and God bless you all.
Thank you, man. Please let's celebrate one more time. The outgoing Dean, School of Dentistry, Professor Idia Niboko is there. Yeah, I'm put your hands together for her. I know you can do better than that. Thank you so much. So I will remind you, she's the incoming CMD of Right, we're going to take goodwill messages very quickly from our deans and directors that are here present. I'll let them know in the order in which they would come. Secretary Ministry of Health is ready. I would invite him. But just before that, I want to welcome the Dean of the School of Basic Medical Sciences, Professor Humphrey Osabolo. Welcome, sir. So we'll take in a minute one dentist in government. The Permanent Secretary, Ministry of Health, Edo State, Dr. Stanley Ohim. For him as he comes in. So.
The Vice Chancellor, University of Benin, ably represented by the Deputy Vice Chancellor Academics, the Provost, College of Medical Sciences, the CMAC and the DCMAC, University of Benin Teaching Hospital. I don't know whether to call him an angel now. Professor Michael Kunseri, our very distinguished alumnus, our permanent secretary, my very good friend. You see, I deliberately skipped the dean and the incoming CM. She's my mommy. I'm sure maybe that will just suffice. This is our mommy. This is the one who truly say, now our mama be this. Professor Mrs. Idia Niboko Zeyamo, whose husband is my father. On behalf of the people and government of Edo State, ably led by His Excellency, distinguished Senator Monday Okpebolo, and then the Honorable Commissioner for Health, Dr. Cyril Adams Oshomole, I bring you very warm greetings. And as a dentist, I'm very happy to see what is happening today. Because many years ago, we really were in our cocoon, were in our shell. Not so much was heard about dentistry. But I'll say that during the World Oral Health Day for this year, a lot of people actually believed that dentistry has not only arrived, but we are here to take whatever belongs to us. And if you don't hold onto your own very well, we'll take it from you. I'm happy that a lot of people are here. The hall is full. And before now, I'm sure even in very many NMA functions, we struggle to get people to come. Even the ones that take place at the doctor's house with TBTH just behind. But when you have movers and shakers who can make things happen, like our mommy, you know that quite a lot can really happen. I want to thank the School of Dentistry, the University of Benin, for bringing this out of Ugowo and taking it to this place here. I also want to say that I'm very happy and delighted that what has never happened before is happening now. By the special grace of God, I'm the first dentist to be a permanent secretary in the history of this state. And then not just me, we currently have 2 permanent secretaries who are dentists. Dr. Mrs. Adesua Urumide is also another one. So please, I want to just let us know that whatever it is that as a government that we can do, that we can support with, we are more than willing, we are more than ready. Because even when I got to know that we're going to use this place, I was happy because ordinarily or usually, this place we don't give to outsiders. In quotes, if you are not part of a State government, you won't get this hall. So when I even saw that we got this hall, I was very happy. I did not know how we got the hall. I'm sure some of us know how we got the hall. And some people who made us get the hall. All right, I'm really happy. I'm excited to be part of this, and our hope and prayer is that it will get better with us. And then let me say lastly, Dr. Dave and I were discussing yesterday, so now we have quite a number of staff, UBTH, UNIBEN, not like the way it used to be. Maybe the lecturers are doing more than they were doing when we were there, I don't know. But I see quite a number of young people, our students, getting distinctions here and there. So I'm now wondering, is it that dentistry is now very easy, or the lecturers are now milder, unlike the way it was with us? You know, dentistry was it was very tough. Dentistry was actually, when they give you that BDS, you will know that it's not only in learning but in character. You have to trek. You don't have the right or privilege to take a bike to School of Dentistry. You have to wear shoes that must have rubber soles, otherwise you'll be in trouble. Earrings must not dangle, all kinds of things. So getting or bringing the car to that place was something else. So we are happy with what we see. A lot of communication, good relationships between staff and students, and we are really, really happy. I want to just say this, that like some persons have mentioned, UBTH is very, very lucky. Very, very lucky to have our mommy as incoming CMD. She knows how to get things done. She knows how to get the job done. And she has, by the special grace of God, very strong pillars to get the job done. So I'll just appeal to us to know how to also talk to her to get the job done. Because UBTH is really, really going to enjoy so much from her leadership. And I know that from what Dr. David has been saying since yesterday, I hope other people will now talk where we are. Because it appears that everything is going to be dentistry, dentistry, dentistry. And so, for some of us who have always, maybe I don't know, but I'll just say that even when I filled my jam form then, it was first choice dentistry, second choice dentistry, third choice dentistry. So some of us have always, okay, but it wasn't like this then. I'm happy that it is like this now. And all the support that we need, all the prayers that we need to support, we pray that God will help us achieve much more than we can ever imagine or dream of. Thank you. God bless you all.
Thank you, PS. PS, I just wanted to inform you that in final year class, they have a bus that carried them to class and to the hostel. They actually also take breakfast sponsored by the dean. Yes, they have lunch too. So things have changed. Thank you, PS. We appreciate you, sir. Like the PS mentioned, he is one of those inevitably that has broken the glass ceiling in government for dentists occupying positions. We have also with us, like we mentioned earlier, one of the permanent secretaries who is also a dentist, permanent secretary Edo State Health Regulation and Monitoring Agency, Dr. Adesua Orogido. Let's celebrate her this morning. Thank you for joining us. A very distinguished madam. We'll do the introduction later. We're moving right away to take the next good message. Please, I want to quickly prepare the Dean School of Basic Medical Science, the Director Institute of Child Health, and HOD Mental Health. Please prepare for your video messages. But right away, we're going to be taking representative of the Commissioner for Women Affairs, who is the permanent secretary here with us in somebody, Secretary, Ministry of Women Affairs at those state, Mrs. Irenise Ihensekin. Welcome.
Vice Chancellor ably represented by the Deputy Vice Chancellor, the Provost, my doctor, my sister, the first female orthodontist to be Chief Medical Director, UBTH, Professor Idia Izeyano, all professors present, all academic and non-academic staffs, ladies and gentlemen. Greetings from the Honorable Commissioner for Women Affairs and Social Development, Chief BC Maria Idaomi Esquire. And I'm really glad to be amongst everybody here. I will read our welcome good message. It is with great honor and privilege that I stand here today, representing the Honorable Commissioner Edo State Ministry of Women Affairs and Social Development. So at this remarkable occasion, the 14th Distinguished Guest Lecture Series of the School of Dentistry, University of Benin. First, let me commend the leadership of the university and the School of Dentistry for sustaining the intellectual tradition, which has become a platform for knowledge sharing, professional development, and academic excellence. Over the years, the lecture series has provided a lesson where ideas meet innovations, where experience meets aspiration, and where academic discourse inspires practical change in our society. The theme and focus of this year's lecture are timely, as dentistry and indeed the entire health profession, it plays a crucial role not only in physical well-being, but also in the holistic development of our communities. At the Ministry of Women Affairs and Social Development, we understand the health. We understand that health is an indispensable pillar of human capital development, and we are deeply committed in the initiatives that improve the health outcomes of our people, especially women, children, and other vulnerable groups. Your dedication is locally training outcomes, ethical and community-oriented profession commendables. Beyond academic excellence, this work has a direct impact in social development as access to quality health and can influence relevant quality of life, productivity, and dignity. On behalf of the Honorable Commissioner, I celebrate the School of Dentistry for your contribution to education research and service delivery. I also congratulate all organizers, faculty members, students, and distinguished guests present here today. As you proceed with this year's lecture series, I encourage you to continue listening, collaborating towards academic government and professionals with it to further strengthen dental education, research, and community research in Edo State and beyond. Once again, congratulations to the successful hosting of the 10th edition of this prestigious lecture series. I wish you fruitful celebrations and continued excellence in all your endeavors. Thank you very much.
Thank you, PSMA. We appreciate you. Thank you for the good message. I want to respectfully invite Dr. Abayafo Ohigiato, the head of department of the Department of Mental Health, Uniben UBTH, to join us. After Dr. Abayafo will receive the Director, Institute of Child Health, Professor Ayebe Sado. After the Director, we will receive the Dean, School of Basic Medical Sciences. And after that, we'll move on to the provost. This video has together as we receive Professor Ohigiato Abayafo, a former president, OLB UBTH.
Thank you very much. I'm extremely delighted to be at this function. Attending this event has become a tradition for me. Permit me to stand on the existing protocol. Chairman, very focused Vice Chancellor of the University of Benin. I'm very well represented here by the Deputy Vice Chancellor, administration, my great pleasure to join you at the 14th annual scientific conference and alumni reunion, and indeed the 10th Distinguished Lecture Series. A 3-1 event. This gathering is not only a celebration of scientific excellence, but also a testament to the enduring legacy of this great institution in producing skilled, ethical, and innovative dental professionals. Year after year, the School of Dentistry has upheld the highest standards in education, research, and service. And this event reinforces our shared commitment to advancing oral health and overall well-being in our communities. To our distinguished alumni, your achievements across the globe continue to inspire the next generation, and to our faculty, your dedication shapes the future of dentistry in Nigeria and beyond. And to our students, may you seize every opportunity to learn, grow, and innovate. On behalf of the Department of Mental Health, and as a proud member of the Uniben academic family, I extend heartfelt congratulations to the organizers for sustaining this remarkable tradition. I fundamentally congratulate the present Dean of Dentistry, the outgoing Dean of School of Dentistry, and the incoming Chief Medical Director of UBTH on the very giant strides she has taken in a very short stay as Dean of School of Dentistry. And this is an eye-opener to what we expect when she comes in on Monday, 18th of this month, as Chief Medical Director of the University of Benin Teaching Hospital. I have no doubt, and indeed many of us are unequivocal about it, that this is the best thing to happen to the University of Benin Teaching Hospital at this material time. Indeed, we are very geared up to make very profound and profuse contribution by way of total and complete cooperation with management. Thank you very much, and may the School of Dentistry continue to shine as a beacon of excellence. Thank you.
Thank you so much, Professor Erugiato Adanyofu. We appreciate you. Let's put our hands together as we receive the Director, Institute of Child Health, University of Benin, College of Medical Sciences, Professor Ayebo Sado. Hands together for her as she comes up.
Good morning, everyone. The Vice Chancellor, ably represented, permit me to stand on the protocol that has already been established. It is with excitement that I joined the School of Dentistry as they mark their 10th and 14th year anniversaries of the various things that they're doing. Yes, my friend, Professor Idia, this is the first time I'm seeing you since adding another feather to your cap. Congratulations. The Institute of Child Health incidentally are neighbors with the School of Dentistry, and we collaborate on various issues. So I'm so excited about this, and then looking at the theme of this year's conference, the sub-theme says community dentistry, and they're looking at public health, an area of interest. to us in the Institute of Child Health. So congratulations as you go on with your conference. I also am excited about what the alumni is doing. You know, every time when we are meeting students and we're clearing them, they say dentistry, 25 students, and we're wondering, this small faculty. But it's not about size, as we can all see. They are small but mighty. Small but mighty. So I would say that all other alumni look at what dentistry is doing. It's not about numbers. It is about collaboration. They are a small, close-knit family, and that is a very good point. So when you are united and focused, you are able to achieve a lot. Now, for the Dean of Dentistry, she's just been on the last 8 months. And we can see the strides she has made in the School of Dentistry. What does it tell you? Somebody who not only knows what to do, but how to do it. And therefore, UBTH, you have a lot coming to you. Because not only does she know what to do, she knows how to do it. So with a win-win for everybody, School of Dentistry, UBTH. So congratulations to School of Dentistry as we celebrate today, and congratulations to UBTH as we welcome our new CMD on Monday. Thank you.
Thank you, Mark. We appreciate your kind words. Right away, the Dean, School of Basic Medical Sciences, Professor H.B. Osabolo. Joins us here very shortly. Thank you, sir. Let's make way for him. Just off the comments of Professor Ayebo Sado, she said dentistry is small but mighty. You know, a lot of people have seen the small. They are about to see the mighty. They are about to see it. I'm not missing words. At the School of Dentistry has seen the mighty under 6 months. Which is about to see the mighty. Let's welcome the Dean, School of Basic Medical Sciences, Professor Humphrey Osabolo.
Without wasting too much time, I want to plead with the Vice Chancellor to allow me to stand on the already established protocol. Vice Chancellor, sir. Thank you. Members of the High Table, distinguished colleagues, invited guests, I thank you for inviting me to this conference, 10th scientific and 10th guest lecture. I also want to appreciate the Dean, School of Dentistry, and the incoming CMD of University of Benin Teaching Hospital for the invitation extended to the School of Basic Medical Sciences. Myself and all staff and students of the School of Basic will say congratulations for this feat. I also want to thank and appreciate all members of School of Dentistry, both the lecturers, students. In fact, I want to reveal something. I've been attending conferences both national and internationally. This conference qualified to be an international conference. Yes. So, congratulations. I appreciate all the effort you are putting. I also want to put on record that for a very long time, we have been hearing of dentistry, but they have been very quiet. And from the time Dean took over, dentistry is making waves all over the place. I hope we will be able to continue that. You know, when I joined the university in 2009, I was admission officer. I said, really dentist, 25 students? I said, I know this is too small. We need to increase, but they told me that is the policy at that time. But as small as they are making waves. They are powerful people. So congratulations once again. I want to say that this conference will not be concluded if we don't come out with scientific papers that will be published in very reputable journals. I hope that is being considered. So my Dean, Vice Chancellor, I want to say once again, congratulations for putting this together. Thank you and God bless you.
Thank you very much, Professor Sadolo. We now take the next goodwill message, and this is by the chief host of this event, Provost College of Medical Sciences, University of Benin, Professor Wilson Sadu. Can we welcome him, please?
Good morning, everybody. My Vice Chancellor, Professor Edoba Bright Amorigi, SAN, ably represented here by Professor Osumbo, the Deputy Vice Chancellor, Administration. Please permit me to align on the already established protocol. I'm not going to stand on it. I put on a bit more weight lately, so I don't want that protocol to come apart. But I must welcome our guests who are here from us, from the States, the two peers who are here with us, my friends and brother from UBTH, DCMAC and DCMAC, thank you so much for coming in. The guest speaker, I've heard a lot about you, Professor Chris. Thank you for what you've been doing. I've been inundated before today of your goodness to dentistry, to the college and to the University of Benin. So on behalf of the college, I want to say thank you. This might be the only opportunity I get to say thank you in person. Thank you so much. What you have done has reserved a place in our hearts. I will pray that God will help you and the Lord will see you through because of these things that you have done. I also want to acknowledge the deans here present, past deans, heads of departments, distinguished faculties from the college, especially from dentistry. I particularly want to recognize Professor Moon and Irama over there. Thank you so much. You know, it's becoming more Irama each time you look at him. Please, can we clap for them, please? I'm so delighted to be here today because this is probably the last event that the Dean of School of Dentistry will be my Dean, because by Monday, she will now be my CMD. Power has shifted. I'm sure it never really crossed your mind. But I would like to say this before I go on to my main address. When she came in a little over 6 months or 7 months ago to join the system, I had a one-on-one talk with her. And there we pledged our support to each other. I support dentistry, she will support the college. I didn't know what I was in for when she made that commitment. I've come to know her in person. This is a very distinguished, nice lady. She's a sweet sister, she's a sweet mom. She's a go-getter. She sets incredible targets. And then you are looking at her and wondering how she's going to accomplish them. But I have since learned, whenever she's telling me about some crazy idea, I just nod along and pray along with her, because I know what it will come to pass. The other bit I like about her is her respect for persons. She's a team player. She never says, oh, because I'm doing this, I want to surprise the provost. No. she will call me immediately. Oh, this is what is going on. This is what is going on. This is what I'm about to do. Those kind of people are rare. You know, coming here today, I have been at different conferences. This is the 14th and then the 10th Distinguished Lecture Series. I've been at all of them since I became dean. I must say that first, your consistency, the camaraderie between all members in dentistry, I've seen it grow, I've seen it increase, and I appreciate it. The peace that you have now shared, please continue in it and let it grow. It is only in the presence of peace that growth will occur. It's only in the presence of peace that individual development will occur. So please continue in it. It's so beautiful to see. I've seen it all. I think that was part of my problem this morning. I thought that in 5 minutes I would be at the venue. Somehow there was a dissociation between the fact that the venue is here and what I was thinking was in banquet hall. God bless you. When I came over here, it just occurred to me that this is a seismic shift. And it's only Madam D that does all this kind of seismic shifts. And you know, a very big seismic shift happened. It's last week Friday, and that has brought on, for the first time, the first female CMD, the first dental CMD, and we are so delighted. We are pleased, we are happy, we're praying for her that she will do well. I will tell you this even in public. These characters that you have been displaying to me and to the college, continue in it. University of Benin, UBTH, does not know what they have yet. University of Benin, UBTH is so blessed. The blessing will begin to unfold by Monday. You know it. I know it. But the majority of people don't know it. Usually that's the way God works. And sometimes it surprises us. And then while we are wondering at what we have, it doesn't take too long for God to show us that He's in it. And He has blessed us. Thank you, Professor Isaiah Yamu. You are a blessing to the college. You are a blessing to UBTH. And you are a blessing to the University of Benin. I wish you well. The theme for this conference is another seismic shift. We are not talking about those states or Benin City. We are reaching very wide. Oral health in Africa, we are commanding things to happen. Yes, we are commanding things to happen. You see what some seismic shift in metamorphosis to CMD can do. You begin to think very wide. I know that I haven't looked at some of the abstracts, that you are going to have a very lovely session together. My prayer is that you'll be able to harness the beautiful findings that you are going to be discussing at this conference and let it be known to the rest of the world. Let it also be translated into action. Incidentally, those are the things we are looking at the college conference that is coming up in September. And I must thank dentistry for this, despite the fact that the time difference between your conference over the years and the college conference since its inception is short. We still managed to find dental representations at the college conference. Can you clap for yourselves, please? I must tell you as provost that I appreciate it. And for your conference, I wish you well. I wish you a wonderful deliberation.
I pray that everybody will have a good time. Really take time out to rest. The country is becoming, I won't say anything. Finally, I must speak to the comments made by my friend, the PS, concerning the distinctions that we are seeing more and more now. I will tell you this. I must respond to it as provost. I will tell you this. We have found that our students, our products are doing well all over the world. We have seen them. A big example here is our brother here who is the speaker. They are doing well. And because of the way we assess our students, we more or less belittle them and put them in a terrible position. They can't compete favorably with their colleagues in the global stage. And we know they are just as good, if not better, in so many instances. So some years ago, we decided to recalibrate and adopt an assessment system that is consistent with best global practice. So now we are unfolding the performance, the true performance of our students. So all the distinctions that you are hearing and seeing, they are truly merited. As students, I look everywhere I go to in the world, Unibest is Unibest. There's no shaking. Chairman, sir, I apologize for using that word. There's no shaking. It's like if you are a Bible person, God says you should give, and then it will be given to you. Good measure, pressed down, shaking together. Unibest is what? Pressed down, shaking together, no shaking. And that is consistent with the way we want to do things in the college. So, long live the School of Dentistry, long live the College of Medical Sciences, and long live the University of Benin. Thank you very much. I want to immensely thank the Provost for his very kind words. The Provost, College of Medical Sciences, Professor Wilson Sado. Thank you so much, sir. We're taking this a step higher. We're moving on to our special guest of honor, the Chief Medical Director, outgoing of the University of Benin Teaching Hospital. Here represented physically by the Chairman Medical Advisory Committee, CMAC UBTH, a distinguished cardiothoracic surgeon, Professor Stanley Okubo. Let's put our hands together for him as he comes to give us his remarks. Thank you, sir.
Good morning, everybody. Mr. Vice Chancellor, sir, permit me to align on already established protocol. I know we have spent a long time already on some of these formalities, but I cannot but remember all the different annual scientific conferences that we dentistry has had, because I've had the enviable privilege of being part of all of them, I think for the last 6 years or more when I was in management. And I've had to represent my chief medical director many times on them. And I remember how the program has moved. I saw Professor Azudo smiling when he was, because we came from banquet hall where we used to share palm wine. And so we have upgraded. I remember last year when they were talking about AI. So I'm not surprised today we are talking about Africa, because I know that dentistry has always been at the forefront of progress in medicine. I think last time I shared the same thought, that we do envy what you have here going. There are so many things I could say about them, So I need to say them because on behalf of my principal, because these were some of the things he would have said. One of them is your ability to harness your alumni, and especially those that are in diaspora. I can remember vividly that every time when you have this your annual conferences, even in your pre-conference cocktail, you have international people, international representations from the US, from the UK, from all parts of Nigeria and indeed some parts of Africa. And it has been consistent. Unfortunately, yesterday I missed the palm wine in the pre-conference cocktail. I'll collect from Azodo. But it's always surprising that you're able to do this, and I dare say the School of Medicine needs to up their game and learn, because we are still struggling to get our alumni together and to start something like this. The other thing is the giving back to the school. The giving back to the school is unparalleled. I can say it because I've been in University of Benin Management for quite some time now. Our guest lecturer, Professor Kuse, was with us just after COVID. And I know how many times he will call us and call it. We are sending this, we are sending this. I hope you guys are ready. We get this, you know. We have benefited immensely from equipment, from consumables, from training, from a lot of training. The past immediate past thing can remember. When these people come in, you have wet labs, training sessions. It's the hospital and the university is trying to catch up with you in the way you go about it. So I really want to commend you, and that's part of the reason. That's the felicitation we bring this morning. As a management, we have not been able to do so much for dentistry, actually, just be frank. I know we, as management, we do support the annual conferences, just a little we can. Somebody like Professor Kunseri has not really asked us in management for something. But I think I've spoken with, we spoke with one of your guests that has come before, Dr. Honorable Uvo, who came in to start implantology. And I can tell you, we took it in the last HMC, I think penultimate HMC meeting in the hospital, and we named him a visiting consultant and lecturer in, I think, orthodontics and implantology. Is it? Prosthodontics and implantology. We'll be very glad if Professor Okusere would take such a role, because this is something we need to do. We're not paying them, we're not paying him, but it's a recognition of their contribution to the growth of dentistry, to the hospital, to the training that is ongoing in dentistry. We would like to partner more and more and more with you. And I'm sure with the coming of first female, first dental surgeon, chief medical director, I'm sure this collaboration will even continue and even grow stronger. So we can't wait. We can't wait to see the growth that, the innovations, the things, the inspirations that is in dentistry overflow to the general UBTH, because UBTH is ready for you. So on behalf of the chief medical director, I want to welcome you to this conference and want to say thank you for all your contributions to the growth of the hospital. Thank you very much.
Thank you very much. Can we give the representative of the CMD another applause? Distinguished guests, ladies and gentlemen, we will now bring to the microphone for his address the chairman of this occasion, the Vice Chancellor, University of Benin, Professor Edoba Bright Omoegie, SAN, is ably represented here this morning by no lesser person, the Deputy Vice Chancellor Administration, Professor Christopher Osubo. Can we give him an applause?
if you've been watching events, you will see that most of the speakers, when they come up, they will say, Mr. Chairman, permit me to either stand or align. So the vice chancellor wants to sit. Okay. This is an address by the Vice Chancellor, University of Benin, Professor Eduba B. Omorige, Senior Advocate of Nigeria. Towards the Distinguished Lecture Series, 14th Scientific Conference, and Alumni Reunion of the School of Dentistry, which is holding today, 14th of August 2025. The Vice Chancellor would have loved to be here, but he's out of town. That's why he has not been able to make it. And so he asked me to represent him. So he brings his warm greetings. I bring you special greetings from the Governing Council, management and staff of our great university on this auspicious three-pronged event organized by the School of Dentistry. It is indeed heartwarming to acknowledge that the School of Dentistry instituted the three programs, namely the Distinguished Lecture Series, Annual Scientific Conference, and the Alumni Reunion, in order to enlighten the public about the issues, challenges, and solutions to dental health problems, promote academic discourse, research, and inter-university collaborations, as well as establish camaraderie amongst recent and older alumni in a unique blend of meeting, interaction, networking, and mentorship. This event has been sustained for 14 years, and this year marks the 10th anniversary of the Distinguished Lecture Series. This year's program is unique because the School of Dentistry is celebrating a decade of enlightening the public through the School of Dentistry's Distinguished Lecture Series. And I'm aware that a landmark project, the renovated and fully equipped dental clinic located within the health center complex of the university, was commissioned yesterday. This project, sponsored by a notable alumnus, a member of her husband, Dr. Victor Uviagili, a dental surgeon, underscores the important role alumni play in instituting landmark projects. I urge other alumni to identify needs within the university and to kindly sponsor such. I acknowledge the guest lecturer and keynote speaker of the annual scientific conference, my namesake and classmate of my brother, Professor Christopher E. Okuseri, and for coming to share his wealth of knowledge and experience as he handles the conference theme of oral health in Africa, the state of affairs, emerging trends, and future perspectives. I urge all of you to pay attention and leave with memorable takeaways. On assumption of office in December last year as Vice Chancellor, I put forward a 5-point agenda, one of which is paying attention to staff and students' welfare. I'm therefore impressed that this has been captured by the organizers in the free oral health outreach and treatment at the Faculty of Law at an event held also yesterday. I thank the donors and sponsors for the well-thought-out program. I'm glad also that the School of Dentistry is focusing on the community in this year's conference with a sub-theme, community dentistry, public health services in a developing country, to be handled by a member of our academic community, Professor Sonny Okebeme, the current head Department of Community Dental Health. The University management is committed to manpower and material resource development, and we support any engagement that will promote knowledge and distinction. At this juncture, I welcome heartily the alumni, while as I appreciate the various contributions that you have made to improve the School of Dentistry.
dentistry in particular, we appeal for more. On that note, distinguished ladies and gentlemen, I wish you a successful and impactful conference and reunion as I declare this three-pronged event of the School of Dentistry, University of Benin, open. Thank you very much.
Thank you, a very distinguished Vice Chancellor. We appreciate you for that wonderful address. Sorry about that. Distinguished guests, ladies and gentlemen, with the Vice Chancellor's address, we now conclude the section of goodwill presentations. May I humbly request the Vice Chancellor and members of the high table to now please step down to take the front row as we proceed to take the keynote lecture. Thank you very much. I'd like to call to the microphone to while the members of the high table trying to take their seats on the front row, may I now call on Dr. Ukachi Nnawuhe as he steps forward to take the citation of the keynote speaker for this event. Thank you, Dr. Ukachi.
Thank you for moderating my name, first of all. The chairman, Vice Chancellor, University of Benin, please permit me to stand on the already established protocol as I read the citation of Professor Christopher Okunsere. Professor Christopher Okunsere, please may you stand as I read your citation. Professor Christopher Okunsere, PDS Benin, MSc, MLS, DDPH RCS England, FFD RCS Ireland, Diplomate American Board of Dental Public Health. He is an accomplished academic, clinician, and global health leader with an extensive record of service, scholarship, and impact. Professor Okunsere began his illustrious career from the great University of Benin, where he obtained his Bachelor of Dental Sciences and subsequently did his housemanship in East Teaching Hospital in 1990 to 1991. He took up appointments in 1991 at the Oral and Maxillofacial Center, Port Harcourt, as a dental officer, while also a part-time faculty at the Rivers State School of Health Technology, Rivers State. He left the shores of Nigeria All right. So he left the shores of the country to the Eastman Dental Institute for Oral Health Care Sciences and Mount Vernon and Watford Hospital in the United Kingdom from 1995 to 1999, where he nurtured his clinical and academic skills, working in the Oral and Maxillofacial Surgery Department, the Dental Public Health Department, and the Transcultural Oral Health Department as a clinical observer, postgraduates in dental public health, research, and clinical assistant, respectively.
In his relentless quest for self-development, he proceeded to the Albert Einstein College of Medicine, Yeshiva University, Montefiore Medical Center, Department of Dentistry, Bronx, New York, United States, where he rose from resident in dental public health to chief resident from 1999 to 2001. He took up an appointment as an associate professor at the University of Minnesota, School of Dentistry, Department of Preventive Sciences, Division of Health Ecology in Minneapolis from 2001 to 2004. In 2004, he took up appointments as an assistant professor at the Marquette University School of Dentistry, Department of Clinical Services, Program in Dental Public Health, Milwaukee, Wisconsin, where he rose to become a professor in 2013. During the same period, he was appointed as an assistant adjunct professor in Clinical and Translational Science Institute, Medical College of Wisconsin, Milwaukee, where he rose to become an adjunct professor in Clinical and Translational Science Institute, Medical College of Wisconsin, Milwaukee. He also taught and served as an external examiner at the University of Hong Kong, Faculty of Dentistry, the Prince Philip Dental Hospital, Hong Kong, from 2013 to 2018. Aside his current roles in Marquette University School of Dentistry, Wisconsin, and the Clinical and Translational Science Institute, he was also an adjunct professor in the University of Benin School of Dentistry, Edo State, where he had served in that capacity since 2016. He has held numerous leadership, management, and administrative appointments, such as the President, Association of Nigerian Physicians in the Americas, President, American Board of Dental Public Health, Site Visitor, American Dental Association, Commission on Dental Accreditation, Graduate Program in Dental Public Health. Please, a round of applause for him. He's also the Director of Program in Dental Public Health, Marquette University of Dentistry. Also, Professor Kunsere has served in over 35 committees at this university and the Clinical Translational Science Institute. In addition, he has undertaken 16 appointments in various capacities by the state of Wisconsin, Minnesota, and New York, United States of America, where he has served dutifully and meritoriously. He is a member of over 20 professional organizations, such as the International Association of Dental Research, American Association for Dental and Oral and Craniofacial Research, American Association of Public Health Dentistry, American Board of Public Health, and Association of Nigerian Physicians in America. An accomplished academic, Professor Kunsere has published over 75 full-length peer-reviewed scientific journal articles, 4 books, 6 oral health extensive and comprehensive reports, presented over 35 papers, and over 100 conference abstracts. He's a reviewer for nearly 40 journals and is a member of 3 journal editorial boards. He's currently the editor-in-chief of the Clinical, Cosmetic, and Investigational Dentistry, and the book co-author, Dentistry, Dental Practice, and Community, the 8th edition. His deep passion to eradicate health disparities in communities has prompted Professor Kunsere to raise funds and organize numerous national and international community health outreaches. Of course, he is happily married with 2 adult children. Please, a round of applause as we make welcome Professor Kunsere, an accomplished academic clinician and global health leader with extensive impact. Thank you so much.
Okay. So, it's been an interesting day, I must say, and an interesting couple of days as well. I must confess that I'm humbled by this opportunity to come back here, but most especially, I'm overwhelmed with the enthusiasm I see from my alma mater in trying to continue to be the profession that I admire. So, permit me to say the following, but before I start, protocol is protocol. Mr. Chairman, sir, Vice Chancellor, ably represented by Professor Greg Osumbo, I would ask that allow me to align with all existing protocol. But thank you. But at the same time, to really acknowledge the Dean of the School of Dentistry. Again, I'm not saying it because everybody else have said it. No. She is truly a leader in her right, a mother, a friend, a sister, somebody who is a goal-getter. Don't stand in front of her because you're just going to miss the point. She's going to get where she wants to get to. So please, even when I was told, before she even became a dean, that I was going to be the keynote speaker, I said to Philip, who kept tormenting me with phone calls and text messages for almost a year. I said, oh, Philip, I can't make it. Oh, Philip, I can't make it. No, sir, no, sir, no. I said, Philip, please, please. Okay, give me time, give me time. But somehow I must say, he's a wonderful guy. He gave me time, he allowed me, gave me my space, and I said to him, I think it was May this year, if I remember correctly, I said send a letter and give me 48 or thereabout, I will make a decision, I'll do that. And truly, did I make a decision in 48 minutes, in 48 hours? No, I did not. I was still trying to work out my logistics, but I'm happy I am here. I am happy I am here. Well, I think, again, thanks for all the accolades. I could not have been where I am today without this dental school. After my parents, this dental school laid the foundation of where I am today. And I am proud to be an alum of University of Benin School of Dentistry. So my colleagues will tell you in America, any meeting I attend is bold, University of Benin. I am not shy to say it. I'm a product of Nigeria, University of Benin, Nigeria. So, let's get to the task at hand. When Philip shared this topic, he didn't allow me to pick a topic. He shared a topic with me and said, Dr. Okosa, this is what you're going to speak on. I'm like, why don't you allow me just speak on one of my research projects? He said, no, sir. Okay, it's your gig. You give me what you want me to talk about. And then he went on and said, oral health in Africa. I said, not even oral health in Nigeria. I'm like, what are you doing? Oral health in Africa. So you want me to just spend hours and days combing through the literature to figure out what I'm going to say? I said, well, okay, it's your gig. I'll do it. Okay? So I'm going to try and work very hard to walk through what task he has given to me in about 50 minutes. I trust we drag over time. How long do I have to speak? Oh, you have an hour. Oh, you have 50 minutes. Oh, I'm like, oh, okay.
So what I have done, I've tried very hard to cut my slides to match his time. So I will sometimes be a bit fast, a bit slow, because there are some of the information I am going to share with you today that I'm hoping should be almost something that we are all very familiar with. If not, hopefully I will be able to gauge my audience and know when to press the gas pedal or release my foot from the gas pedal. So, my journey is simple. Everybody knows it at this point. Okay, I don't need to go back down that road. But let me quickly say, I have no conflict of interest to declare. Again, I'm doing this out of the goodness of my heart and for my school, my alma mater, the University of Benin School of Dentistry. And whatever information I'm going to be sharing about the product here today, I have no shares in those companies. Be rest assured, I have no shares in those companies. Okay? I'm like a regular guy, like a lot of everybody, or a lot of everyone here. So, I'm not very good at staying by the podium, so allow me move around. It keeps me still. Even when I lecture at school, I don't. The students, I kind of walk around the aisle. That's kind of my, the students already know I just walk around the aisle and then, just talk. But I'll just be comfortable standing here. So I'm going to take you through the following areas. I'm going to talk about oral health. I'm going to share some of the basic facts about Africa, because the topic at hand is oral health in Africa. I'm going to actually now spend some time identifying and talking a little bit more about the common oral diseases we have to manage as a profession, which means I will talk about prevalence and trend. I would also talk about education and training as it relates to workforce and research. And I will sort of wind this down towards talking about emerging trends in oral health and move slowly into strategies for growth and development. I know he said future prospects, and I said to him, no, I would say strategies for growth and development, and I would end my discussion talking about take-home messages. So let's move here. We are all dentists, or there are dental students among us. But please, let's not forget, what is this profession that we're talking about? What is our understanding of what dentistry is all about? I chose to start here because my intent is to provide context as I try to unravel the topic at hand today. We're fully responsible for evaluation, diagnosis, prevention, and treatment, whether surgical intervention or non-surgical intervention of oral diseases or conditions that affect human beings. I use this word human beings, but I know our minds are oral cavity and supporting structures. We will get there, but I hold on, just stay with me here for 1 minute, okay? So we're very familiar, this profession of dentistry is all about. But before we get there, we are not just dentists interested in procedures. We're interested in the oral health of our population. I want to emphasize this because sometimes we get carried away and think that dentistry is all about procedures. It's all about restoration. It's all about extractions. It's all about orthodontics. And I tell my students and my colleagues, we are, as a profession, interested in the oral health of the population, or of the public, or of that individual that can afford to pay you when he or she comes into your office. So please always keep that in mind, that your task at hand is to provide oral health for that patient, because oral health contributes to overall well-being. Body starts from the mouth. If we get that concept clear, we will have a different approach to what we do. and we will build a profession that we already have now that is strong. Look at all of us. CMD is coming. First female dentist. It's going to be a CMD. I've heard so many firsts today. Dentists breaking barriers, breaking boundaries, and just moving on. As a CMD, she has the task of everybody. Everybody. So think about it. It's a long definition. But at the same time, when this task was given to me, and I was going through all the research that has been done, the first thing that also came to me was to remind myself and remind my audience that in 2000, in the year 2000, there was the first ever Surgeon General's report in America. America is a developed country, but the first ever Surgeon General's report brought a lot to light. It reminded us as a profession the full meaning of oral health and the importance of oral health to overall health and general well-being. It helped us document the extent and severity of common dental diseases and how far we have gone. But it did not end there. It reminded us that we still have a silent epidemic. And what is that? Dental caries. A lot of us have to treat caries. That is the commonest dental disease that we all have to manage as a profession. It's not going away. So imagine. So, if we have all of that all wrapped up in our minds, very much aware of where I'm coming from, let's sit back and say, okay, we're African. I can tell you right away, second largest continent, Africa, second most populous continent, 1.5 billion. 1.5 billion of all. And there's an estimated growth rate of about 100 million every 3 years. We have 62 countries in Africa. So when people talk about Africa, and I'll throw in a joke very quickly here. Everybody, every black person in America who is not a native African American, so to speak, is from Africa. I have to tell the American, no, I am from Nigeria. Nigeria is a country in Africa. You will be shocked that most Americans don't recognize that Africa as a continent. They think Africa is a country. They're like, what? People call it like, no, from Nigeria. That's 6 countries in that African continent. Oh, okay. Really? Like, yes. East, west, south. So it's important. Nigeria, African country. So, you know what, we should be proud. 206 million people, estimated growth of about 2%. But is this a blessing or a curse? 300 or 3,000 different ethnic groups speaking different languages. You be the judge. But that's the reality. That's what we have to manage. So this is it. This is the problem. 47% of 1.5 million have access to those services that myself. Let me ask somebody. Talk about 17% of 1.5 million. Each person is supposed to have 28 or 30 teams. That's how many you have to manage. That's it. How many you have to manage? So we have what? Profession will grow. When I graduated many years ago, we were only 9, my class at Capital University. Only 9 of us. Getting 25, and I had 25 is small. It's about 9 when we graduated. Only 9. I graduated that year. And before us, it probably less than something. Wherever it's 13, that 25, number is growing. So that's the time we want to recognize have this wide genetically diverse people. Africa, our genetic makeup is so diverse. Now, in the practice that we are going to do it, as we talk about inheriting trends, right, important to us as well. So, what are the common diseases? Vegetables, adulteral disease, and all other disorders. I forgot my mic. Because I'm so passionate and so enthusiastic about what I have to talk about that my mic was no longer important to me. But I guess you guys were hearing me because even when I teach at school, even when I teach at school, I don't use a mic. It feels like I just move around from one end to the other. So I'm sorry, okay? I'll try and keep it close. If I forget, remind me. Okay. All right. So I'm trying to remind my audience that we have dental caries, periodontal disease, and edentulism. There's many more, but those are very common conditions we have to manage as dentists. And as I go along, I would share with you and our colleagues out here, there's a lot of research showing the connection between periodontal disease and systemic health. We're going to talk about that. We have about 48 million people impacted by oral diseases. That's about 44% of our 1.5 billion. But the interesting part again for you to recognize is that all these oral diseases I'm talking about share a modifiable risk factors with systemic diseases such as cardiovascular, cancer, diabetes, chronic respiratory disease, and these 4 are non-communicable diseases. And these 4 diseases are non-communicable diseases, so we have work to do together. There's need for collaboration. There's need for partnership. But it's also the case that there's low priority when it comes to oral health in Africa. And this low priority undermines prevention, which we know is key in terms of preventing some of the common oral diseases we have to deal with. I will tell you, and you know as much as I do, that dental caries, the commonest dental disease, is preventable. Honestly, it's preventable. But we have not been able to eradicate it. We have not been able to really get a good handle on it. But we do know that that disease is preventable. Even the common periodontal disease, gingivitis, is also preventable. But we still see patients in our clinics with gingivitis, periodontal disease. 70% of people in sub-Saharan Africa spend about $1 per person per year. $1 is, excuse me, I don't know what what's $1 going to buy for you? Not a lot. I do recognize that, but what is $1 going to buy for you? That's kind of where we are. So, half of the countries in Africa do not have an oral health policy. Half of the countries in Africa do not have an oral health policy. And our workforce is not adequate. We still have work to do about our workforce. So I'm happy to hear that. I think I did hear that we are going to be increasing the number of dental students graduating from our university. So hopefully, Nigeria, with the most populous country, will help to start, increasing workforce. I know we're very good at helping other countries with our physicians and dentists. There's nothing wrong in doing that. Okay? But we will come back. We don't have a choice somehow. We'll try very hard to give back. We're the most populous country. We have the most resources somehow, somewhere, so we can give back. So that's a good thing. So 90% of the dental caries that we find in Nigeria or we find in Africa are untreated. 90% are untreated. Oral cancer associated with smokeless tobacco is another problem in Africa. I'm going to talk a little bit more about all that. Norma, this scares me. I will tell you. It's not, I haven't read about any in southern Nigeria, but in some areas in northern Nigeria, you won't see Norma. I have a slide about that. What is it associated with? Poverty and malnutrition. It scares me when I see the pictures. I'm just like, I can't believe this. Why? How? Huh? It's a 90% mortality if untreated. 90% mortality. These kids die. Just go. Overall, this high prevalence of oral diseases impact general health and overall well-being. So for us as dentists, for the physicians, we have to work together. We have to. So let's take a quick look at this table here. I decided to just actually spend some, this is what I want you to pay more attention to. I'm the numbers guy, but it's always important. This is where we are. North Africa, highest prevalence of untreated dental caries. South Africa, high prevalence. Central Africa, low prevalence of untreated caries. Okay? So that's kind of where we are. So look at this map. This was a study that was done and published, but strictly talking about 12-year-old children in Africa. You can see where the highest prevalence is. Eritrea, Sao Tome, and Zambia and Nigeria. Don't forget, I know we're talking about Nigeria having the lowest prevalence, but that's what is available in the literature. I don't know if it's true. I haven't done any study in Nigeria, but hopefully, as we make progress in this country, as people get engaged in research, that's why I said to you guys, I was so excited when I saw the amount of work going on. We might find more, but this is what was shown when it comes to 12-year-old kids in Africa after they pulled so much research that has been done in all the different African countries together. Let's move on to periodontal disease. So, periodontal disease is another very common dental condition. It's a significant public health concern in Africa. The incidence of this disease has doubled in Africa. Since 1990, with Western Sub-Saharan Africa experiencing the highest burden of this disease. 22.8% of the individuals 15 and older suffer from severe periodontal disease, which means Dr. Azodo can relate to that, which means that periodontal health is a problem. It's going to impact their general health. They are diabetic. They can't control their diabetes. Please ask Dr. Azodo to help you check. What is their periodontal health looking like? You may not pay attention, but hopefully after this conversation, you might, as a physician, if you are within here or your consultant, you might ask your residents, and they look at these patients, and looking at their diabetes that is not being controlled, can Dr. Azuru take a look and see what's happening in their periodontal health? This condition, periodontal disease, is largely driven by uncontrolled host inflammatory and immune responses with a combination of social, individual, and environmental and economic factors. So it's something we can manage. I think it's important to continue to acknowledge the high prevalence of severe periodontitis, not only in Africa, but globally. And also do not ignore the fact that what we see in terms of periodontal diseases are the late stages, which lead to tooth loss. You go to the villages today, in our villages, all around Africa, you see an older gentleman or an old woman, she lost all her teeth. Nobody did extraction for them. The rest assured, they had no dentist, no assistant dentist, periodontal disease. It was mobile. Before you knew it, it just fell off. And the old lady will tell you, oh, it's aging problem. It's not. It's a disease that led to that tooth falling off. It's not, oh, the woman is old or the man is old. So after a while, that teeth just came off. Oh, you know, I'm old now. It's part of aging. No, it is not. So, there are lots of research going on in this environment, looking at periodontal disease and diabetic control, looking at periodontal disease and pregnancy. There was a lot of buzz, a lot of work that went into trying to look at preterm birth. For the OBGYN, we were seeing a lot of link between periodontal disease and preterm birth weight. So this is what we have so far in terms of prevalence of periodontal disease. We can see that in West and Central Africa, we have higher periodontal disease prevalence. This is assumed to be due to poor oral hygiene and limited dental access. At the beginning, I said 17% of Africa, 70% of 1.5 billion have access to your services and my services. So it should not surprise you when I also do say that periodontal disease is high globally, but it's really high in Africa. And see what we're seeing. Western and Central Africa. Nigeria is part of West Africa. Nigeria is part of West Africa. So this is normal. This is one of the things that beautiful young lady with that disease, malnutrition and poverty. Dr. Odai will be there to help suture the child back. But we'll be happy to prevent it. Doesn't mean you won't have enough work. There'll be enough fractures. Yeah? Okay, thank you. So you see, it's a debilitating gangrenous disease of the orofacial region. 2 to 6 year old. These are kids. It occurs in immunosuppressed adults as well. HIV, leukemia, and other diseases. Largely eradicated in advanced countries. Largely eradicated in advanced countries. But we still have it. We still have to deal with it. Where is it prevalent? Nigeria, Burkina Faso, Ethiopia, Mali, Niger, Senegal. In sub-Saharan Africa, prevalence is 750 million to 1 million, with 90% dying without care. Is anybody happy? Can we do more? So, the reality. Another big killer that you and I have to deal with, oral cavity cancer. Oral pathologist, Dr. Away, the slides. You guys are first to diagnose, right? Huh? When they bring the slide, you can see. Globally, oral cavity cancer is a global concern. It's causing around 529,000 deaths. 90% of this oral cancer are squamous cell carcinomas. On average, more than half of the patients with oral cancer present with advanced disease. So our hands are tied. But emerging trends, we'll see where we are. It is the 6th most common malignancy. 5-year survival rates, yeah, mixed results, some improvement, no improvement. I can tell you, in African Americans in America, no improvement in their 5-year survival rate when it comes to oral cancer. But part of it is because they are diagnosed at late stages. So, a lot of the prevalence of cancer is lower than those in Southeast Asia. It's, again, the reason for that is people in Southeast Asia, a lot of smokeless tobacco, snuff, chewing, a lot of all that smokeless tobacco that they use in Southeast Asia. If you've traveled around, you will see. A lot of these oral cancer occur in people who are above 40 years, 70 to 75%. And approximately 75% of the cases and deaths attributable to this oral cancer happens in developing countries. And it is the 7th most common in Botswana. Like I said, the oral cancer survival rate hasn't really improved much. That even in America, African American survival rate is so low, and they're still worried about what to do about it. But these are the common areas: the lip, the tongue, the floor of the mouth, the palate, alveolar ridge, and other unspecified sites. So this is what we have in terms of data showing prevalence. You can see North Africa have the highest, followed by East Africa. West Africa, we're still doing good. So let's look at a study that looked at East Africa. East Africa has the highest incidence of oral cancer in Africa. Estimated about 7,000 new cases are identified in the region with a mortality rate of 70%. It's interesting to see that about 1.2% of all oral cancer cases in Tanzania as of 2020, and in Kenya, 1.8% of total cancer-related death due to oral cancer. So there's some, good news, I would say. But there's increased incidence. That means new disease. Incidence refers to new disease in the region, largely due to increased exposure to risk factors. Tobacco is a big one. Alcohol is another one. Poor oral hygiene. Viral infections such as HPV. Another one is the late detection. Late detection due to limited access to your services and my services. Patient has a sore tongue that's been there for 2 to 3 years. You just take some more snuff tobacco, put it there. The pain will go away. So, we're trying. We're doing a lot of screening, prevention, early detection, but these are things we need to do to reduce the burden. Screening, prevention, early detection, treatment, and rehabilitation. And trauma. These are the diseases we have to deal with in Africa. Dental caries, periodontal disease, normal, now trauma. Dr. Dai, your area, maxillofacial surgeons, we are seeing fairly reasonable prevalence and incidence of facial trauma in Africa, but you will not be surprised. Look at our transport system, motorbikes. I was listening to a presentation, assault today, domestic violence. So there's still trauma. Higher in sub-Saharan Africa. Higher in sub-Saharan Africa. Nigeria is part of sub-Saharan Africa. More males associated with facial trauma than females. But most people in their 20s to 39 years old are prone to facial trauma. These are in forms of burns, lacerations, blunt trauma, soft tissue injuries, fractures of the facial bone, you know, the nasal, the maxilla, zygoma, and the mandible. But I would ask that this is something here. More males are associated with facial trauma than females. Maybe there's something happening differently, I don't know. I would encourage the young ones coming behind us to do more research in areas like this. I don't know, but this is what the literature says at this point. Again, many African nations lack standalone oral health policies, or their policies are outdated or poorly implemented. Oral health is rarely integrated into universal health coverage. Non-communicable disease strategies. I know there's a recent document where oral health was emphasized in the discussion on non-communicable diseases. I encourage you to pay attention to those documents. I think when you talk about health systems, there needs to be some surveillance and data systems. It's grossly underfunded in Africa. They don't have a surveillance. To the best of my knowledge, I don't know of any surveillance system in oral health, a database like they have in America, that researchers can query to talk about prevalence of any disease, common dental disease. So I encourage us, it can start from Edo State, as small as Edo State, and before you know it, other states will take advantage. And before we know it, it will be widespread. Just data surveillance, just gather this information. Again, in today's world, it is not that expensive. What do I mean? Just have a database and begin to put these numbers inside. There's poor data quality. Also be the first to confess, yes, there is poor data quality compared to what is available in developed countries, but let us start from somewhere and improve on it. But I will not fail to acknowledge that when we talk about our health system and our fragmented policies, there's lack of funding and donor prioritization for oral health. It's reality. It's poor funding. Dental education. It was interesting while I was preparing for this lecture to note that the first dental school was in Nigeria. It was really interesting as I was like, oh my goodness, I didn't know that. After all these years as a dentist, the first dental school was in Nigeria, was in Unilag. But I won't tell you people the significance of this year. You know, there's something about this year that is unique to me. 1966. I leave you to wonder about that. Okay? But there's something that is so unique to me. That's it. So unique to me, so important to me, that year 1966. But I won't disclose it. So keep thinking about it. So that was the first dental school in Africa, was in Lagos. Subsequently, they had Senegal and Cote d'Ivoire, and the rest is history. Okay? When I graduated, we only had 4 dental schools. 4 dental schools: Benin, Ibadan, Ife, and Lagos. But today, we're moving. And I'm so proud to be part of that train that we're moving. But there's still work to be done about our dental curriculum. I know the first presentation I gave in 2012 was on dental curriculum. And I happen to have part of a project that was put together by the Association of Nigerian Physicians in America that got a fund. They were funded by UNICEF or some organization funded that project, and it was a medical dental curriculum review for Africa, no, precisely for Nigeria. So a couple of us flew in from America, collaborated with our colleagues here in America, in Nigeria, and worked on our curriculum, trying to say, look, we need to move forward. We got NUC involved, we got Medical and Dental Council involved, and so it was at that time those documents were prepared and was shared. But I don't know how far it went. I think Ibadan implemented some of it, I don't know, but somehow. But there's still more work to be done in terms of our dental curriculum. Because if you look closely into Africa and their dental schools, depending on who colonized who, our dental curriculum and quite honestly our medical curriculum is tailored to who colonized us. For us, who were colonized by the British, our medical and dental education curriculum is tailored to the British system. So the Francophone, colonized by the French people. Medical and dental is tailored towards their own curriculum as well. So we need to harmonize our curriculum. We need to do some changes. We need to do some tweaking. I'm not advocating for a radical change. But what I would advocate for that is really mainstream is a gradual process. Anything done gradually would really get to where you want it to get to. Don't just go there and say, throw away this curriculum and we're going to start from ground zero. No, please. That's not what I'm advocating for. That is not what I'm talking about. What I'm saying, a gradual tweak here and there. Whatever is redundant in current disease burden in your country or what is happening now, AI is coming, there's so many things coming, there's so many things that we don't have to do. Put it aside. Things that are now front and center. Let us get these fundamentals right. The gradual process would help. So, what are the challenges? While I talk this fancy, let's do some gradual stuff, I do recognize the following things. Not enough faculty at dental schools, not enough dental schools in Africa, not enough dental infrastructure in dental schools, not enough funding opportunities for dental schools in Africa. There's evolution in dental services. Technology is coming. We're not going to be left behind. Technology is coming. It's going to, I'm going to talk about it as I go along here. We have to be in that train. We're all at the train station. We cannot allow the train to leave us. We have to board that train with everybody else. The prevalence and incidence and trends of other diseases in Africa are going up. So, what are the things we have to do? We have to begin to check our educational barriers and financial constraints. This is clearly very important. I would suggest and ask that in terms of educational barriers, there's a lot more that we can do. But I've just been told I have 5 minutes to wrap up my game. Okay? So let's fast forward a little bit here. And I think it's important to pay attention to, we only have 84 dental schools operating across Africa. We need to recognize the importance of training our auxiliaries. We all can't just be there for everybody. In Nigeria, this is what we have. One dentist serving about 38,000 people. When really it should be 1 to 7,500. But please be careful. What I always talk about when I talk about workforce. It is not strictly the dentist to population ratio. Look at your disease burden. Allow your disease burden match your dentist to population ratio. Don't get carried away and say, look, in Brazil they have more dentists to population. More dentists, but they still have high disease burden. So do not allow your dental or your dentist patient ratio to drive you in developing your workforce. So let's talk about emerging trends. We have AI coming. We have 3D printing coming. People can actually print their crowns right there. When I was in dental school, that wasn't possible. Right there in the clinic. Right now, I no longer take impression with rubber-based material. It's all digital. Just click, 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 click. I have everything, and it's transferred to the lab. The guys in restoration, Dr. Sede, can. If we're not there yet, it's coming to us. It's coming to us. Teledentistry. It's global. We're not there yet, we can still do it in the villages. So, we have to make sure the patients are comfortable. It is no longer the old dentistry that you and I were used to. We have to think about, patients have dental anxiety. We have to think about how to manage that. We have to think about how personal data will drive patient care, precision medicine, precision dentistry. And there's growing emphasis on prevention to maintain long-term oral health care and reduce the need for extensive treatment. I was at a meeting in Spain, and I was really excited to see a symposium on oral health research groups in Africa. So these are the groups that we do have right now. African Oral Health Network, Oral Health Initiative, Community Focused Oral Health Research for Equity, African Oral Pathology Research Consortium. I encourage our dentists, our students, our faculty to key into these emerging areas. Nobody does research alone today. You need to be with a group. No successful researcher, including myself standing before you now, I'm no longer, nobody's a loner. You can't be successful. You have to collaborate. So these are all emerging trends. But most importantly, I will wrap my talk with the following slides. We cannot move forward in Africa without leadership, without strategy, without policy, and without people. I think the incoming CMD has actually demonstrated this to us. Leadership, strategy, policy, and people. She's made it happen. Resources, scholarship, partnership, and processes. So let's dive into this. As a continent, as a country, and leadership need to be able to promote oral health and have the vision for oral health. We need to come to this vision and have a strategic plan on how key stakeholders can be engaged in this vision. We need to engage our deans, program directors, faculty, students, residents, and staff. And we need to build and strengthen our clinical care and program implementation. Don't forget, leadership. You have to be a leader. Strategy. What is your strategy? How are you going to do this? I heard the provost said something today that when Madam Dean comes and says, I'm going to do this, he stopped questioning. He just starts because in his head he was like, I know what's going to happen. She's going to get it done, which means she had a strategy in place on how she was going to achieve it. She had a strategy in place. So she would review her strategy. I would say for us, as we talk about oral health in Africa, we have to review, assess, and update oral health policy in Africa periodically or as needed. Generate data to enhance curriculum development, clinical care, and community outreach. Continuous investment in successful and existing programs where necessary, develop new opportunities, increase participation, innovation, and visibility of oral health in Africa. We need faculty, because that's the engine here. They have to develop collaborations, they have to mentor, they have to develop research, they have to support early career faculty, they have to support opportunities for innovation in clinical care, they have to develop opportunities for our pre-doctoral students and our graduate students. These are things we need to do as future opportunities for growth and development, which my friend Philip called future prospects. I know this is a sore spot, resources and funding. I completely acknowledge it. I'm not going to downplay it. I do recognize it. But please continue to tap on the alumni base, especially those outside. Continue to tap. Because all of us, where we all live, we see what alums do for those hospitals, those schools there. So a lot of us are kind of, we're not there yet, but a lot of us are beginning to see that, and we're willing. And especially if you are at my age level, you've been lucky, you've trained your kids, you are still working, there's still some disposable income you can share. So seek opportunities to provide extramural and intramural funding, leverage existing and explore new funding opportunities for faculty and students, and prioritize initiatives based on financial availability and viability. Scholarship, enhance and encourage timely assessment of faculty and students for productivity and scholarship. I thank the provost who said they have now recalibrated. So these grades are not inflated grades, they are real. It resonated with me. So thanks, Mr. Provost, for doing that. So build partnership. It's important to continue to build partnership to support the leadership in determining how best to foster opportunity that promote Africa oral health. Processes are important. You need to have processes in place. If you don't have processes in place, it's just going to die. Implement processes that facilitate program and research project development. So, I know I'm above your 5 minutes. I'm winding down right towards the but take home message. What we lack in resources, we can gain in resolve through partnership, local, national, and global, innovation, and strong institutions that can carry this weight of our ambition. This process requires our collective effort, commitment, and a sense of responsibility as team players. The challenges confronting oral health in Africa is real. So also are the opportunities. The fact that we have smartphones today should remind us of the opportunity to connect globally. The fact that we have smartphones today should remind us of the opportunities we have to connect globally. Same thing when I teach the D4 students, sorry, I said D4 in America, the final year dental students, we'll call them D4s. I tell them, the phone you have in your hand has so much information, not only for talking. Opportunities exist to boost the competency of our faculty, staff, and students in clinical care, research, special and urgent care, community outreach, IPE. IPE refers to interprofessional education. We now have dentists. It's just like when I was in my 5th year in dental school, I was in surgery and medicine posting, collaborating with medical students, learning about hypertension. We're doing more now in America, collaborating with nurses, physicians, everybody. So I would encourage our curriculum to begin to expand into interprofessional education. IPE stands for interprofessional education. GPR stands for general practice residency, and all of this is timing is key. At what point do we do all of these things? That's why I said the curriculum should be a gradual process. But pay attention as we go along. Our task is to harness these opportunities according to our unique circumstances for optimal benefit. In today's environment, we have to think strategically, recognize realities to achieve success. Thank you.
Profusely appreciate Professor Christopher Okunsei, a very wonderful presentation. Do you agree with that? Thank you so much, sir. Professor, please, you just move on a while. We're going right away to take the plaque presentations. I doubt anybody has questions. The police are self-explanatory. Anything that has to come up for this with the policy discussions for the college and for the school of dentistry to make sure that we up our game in the provision of dental services as much as possible. So moving right away, we're going to present a plaque to our keynote speaker. And to do that is none other than the chairman of today's occasion, Chancellor University of Benin, Professor Odoba Bright Omoege, Senior Advocate of Nigeria, here represented by the BBC admin, Professor Christopher Osulo. He will do the presentation of the plaque, and he will be joined on stage for group photographs with our keynote speaker by the Provost College of Medical Sciences, University of Benin, the Dean Outgoing of Dentistry, the CMAC, the DCMAC, the second keynote speaker, and the chairman of the board of the Health Center. Please, the plaque right away. Please let them all join us up on stage for the presentation of the plaque. Thank you, sir.
On behalf of the School of Dentistry, College of Medical Sciences of this great university, University of Benin, I present this award of honor to you, Professor Christopher E. Okuseri, as team speaker at the 10th Distinguished Guest Lecture Series and 14th Scientific Conference and Alumni Reunion. This day, 14th of August, 2025. Congratulations.
All right, the other members of the party will join them for the group photographs. Okay. Yes. Thank you, sir.
Thank you.
Okay, thank you, sir. Thank you, Mars. It's a great seats. We appreciate Professor Christopher Okunsei one more time. Thank you, sir. And for all of the contributions and donations you keep making to School of Dentistry. Appreciate you, sir. Special picture. So we're going to have our tea break shortly. Before the tea break, I'll make some few acknowledgements and I'll give us directions for our tea break. The tea break is going to hold at the cafeteria downstairs on the ground floor. On the second floor. Dr. Godi, it's tea break, not lunch break, have you? Tea break. It's tea break, not lunch break. So there's lunch break later. 1 o'clock. It's tea break. That's the instruction I will see. But before the tea break, I'm going to make a few acknowledgements. I acknowledge very quickly National Financial Secretary of the Nigerian Medical Association, National Consultant Restorative Dentist, University of Benin, University of Benin Teaching Hospital, former Chairman NMA Edo State, Dr. Harrison Omokwa. He's also a former president of ARD-UBTH. and the only person in ARDUBT that occupied almost all the positions before he became president. Thank you, sir. We also have in our midst National Nigerian Dental Association Secretary General, Dr. Franklin Abulime, consultant orthodontist, Area Specialist Teaching Hospital, Edo State. We also have with us a very distinguished dentist in his own right, doing things, he has doings and workings. He's Executive Director, CEO, Rahim Hospitals Limited. He's a former Commissioner for Commerce and Tourism in Delta State. He was a former Chairman, Patani Local Government, Delta State. He's President Emeritus, Ijo Youth Council. He was a former president of the SUG Uniben, the first elected dental president, SUG Uniben, Dr. Chris Ekiyo. Thank you, sir. We also have with us, I'll acknowledge our HODs very quickly, Dr. Joe Otaren, HOD, Department of Orthodontics, UBT, Dr. Morrison Omokwa, Restorative Dentistry, my own HOD, my personal HOD, Dr. Lawrence Igbinosa, HOD Family Dentistry, Oral Diagnosis and Radiology, Uniben, UBT. I saw my HOD somewhere, yes. Well done, sir. I'm still on that training. And then I will acknowledge the Family Dentistry Squad from UBTH. Please bear with me. They are still training me. Dr. Olajumoke Babalola, Consultant Family Dentistry, UBTH. Dr. Oganoju Amo, Consultant Family Dentist, UBTH. Dr. Emeke Uwadia, Consultant Family Dentist, UBTH. Now we have two very special people here that have been here since the beginning of this program. I want to crave your indulgence to acknowledge them very quickly. A former MDCAN chairman, UBTH, Professor of Pathology, Uniben, Consultant Pathologist, UBTH, Professor Ezekiel Ugiagbe. He's here with his lovely wife, Dr. Mrs. Rose Ugiagbe, a consultant gastroenterologist in the University of Benin Teaching Hospital. We have another set of lovely dentists, couple. Dr. Vera Owe, consultant periodontologist, Specialist Hospital, and her husband, Dr. Kelvin Owe, consultant family dentist, Delta State University Teaching Hospital, Elgara. We have consultant family dentist, Specialist Hospital, Dr. Adisua Ebomoyi. You're welcome, man. We have another consultant family dentist from the Edo Specialist Hospital. And he's the coordinator of the dental center in Edo Specialist Hospital, Dr. Dave Ipofa. We have here, by no means the least, a very senior man, but he doesn't like to carry the air of senior man. He's the Director of Dental Services, Edo State Ministry of Health, Dr. Lucky Emmanuel. You're welcome, sir. Have with us consultant oral pathologist. I call her forensic pathologist. Edo Specialist Hospital. She's the chairman or chairperson Edo South NMA State, Dr. Ivu Arizona. Welcome. Consultant oral and oral medicine specialist. Instruction reaching us, those for the poster presentation, please you need to go outside, the assessment is about to start. And judges. So the panel of judges is will include Professor Ediagi Ehikameno, Professor Julie Omo, and Professor Emeka Odai. They are the judges for the poster presentation. Undergraduate category, you know yourselves. Charles Onjoku, Gavon Kolawole, Alice Eweka, S.E. Brown, and Israel Moye. Please just go outside. And then graduates category, Dr. Ina Ororo, Dr. Obeyo Sadalo, Dr. Babalola Olajumope, Dr. Godwin Basi, can go out for our poster presentation. Okay, so that's for Obuku Award. Then for the Professor Isa Yamo Award, Timothy Awolepa, Dr. Hugo Sadiayi, Dr. Osheyi, Dr. Godwin Bassi. Panel of judges here are Professor Clement Azodo, Dr. Esther Uzamere, Dr. Franklin Aburimo. Please, you can go outside. It's for that. So please let me just make the announcement for the tea break. To take more introductions. I must not fail to acknowledge the second oral medicine specialist consultant in South Nigeria. So Izeboya Utobo. I must also not fail to acknowledge a consultant oral pathologist, a very dear friend of ours, and a very supportive husband of our coordinator, Dental Center UBTH, Dr. Dixon Oko. Hold on, sir. Just a minute. So for the tea break, this is the order of the tea break, please. We're going to be having 5 minutes intervals for us to go downstairs. So for the first set of people to go downstairs, members of the high table and the keynote speaker. So I respectfully ask the ushers, please help us direct the CMAC, DCMAC, Professor Okedeme and his wife, the Dean of School of Basic Medical Sciences, Professor Edi Orapo, the former dean, because all former deans are in this category, all former deans of dentistry, the Provost College of Medical Sciences. Please let's go down for the tea break. And then after them, in 5 minutes, we will have all professors and consultants here joining for the tea break. It's ground floor, the cafeteria. There's a cafeteria in this building. Cafeteria ground floor. All members of the high table, all former deans, please, you can go down for the tea break. And then after professors and consultants, after in another 5 minutes, we are going to have all other registered participants. And registered participant means that you have your name tags on. You will only be allowed in there with your name tags. So please, if you do not have your name tags, please put on your name tags. You are only going to be allowed into the cafeteria with your name tags. I want to appreciate our 001, Professor Osagi Akombare, consultant periodontologist. Thank you for being around, sir. So all students, this information is for all students. All students, the Queen Mother has sorted you out. So you know who to meet. Students, you don't need to join the tea break downstairs. You have been sorted out. You know who to meet to sort you out, okay? We'll take some more recognitions before we usher the next set down for tea break. Please, I don't want to forget also to acknowledge who has been with us for a long time now, the Senior Deputy Registrar and a former PRO of the University of Benin, Mr. H.O. Osae. Thank you, sir, for coming around. We really appreciate you. Let's not be as if it was an oversight. It wasn't. I want to acknowledge our senior friend and trainer. We are supposed to have done this before he took the citation. But Dr. Ukachi Unaoye, a consultant community dentist. I appreciate you, sir. Thank you for joining us. I saw your very impressive I'll make it very clear much later, sir. Thank you, sir. Dr. Thank you for joining us. We appreciate you, sir. Thank you, sir. Dr. Uwaila, sorry, I really can't. Thank you, sir, for joining us. And for others we haven't acknowledged, we acknowledge your property. Dr. Thank you again, sir, for joining us. We have some more acknowledgements very quickly, but in 5 minutes, we will take the next set. Yes, representative of ARD UBTH Executive, our clubhouse secretary, and in-law to dentistry, Dr. Emeka Oko. As I was saying, we welcome you, sir. Thank you for joining us. So, DJ, please just give us some soft music while we wait for the second set of people to go down. So, like I announced earlier for the tea break, the first set has gone down already. That's members of the high table. All former deans. So the next set to go down in about 3 minutes will be professors and consultants here in dentistry. Professors, consultants, HODs in dentistry will go down. All consultants also mean consultants in ESH, please. Consultants in ESH, ISCH, anywhere else you're in consultant dentist, please, you will go down as well. DJ, please.
I believe professors and consultants have gone down already. So in the next 5 minutes, everyone will name that. Aside the students, all students who have been sorted out. See WhatsApp president, see your class rep. All students who have been sorted out, see WhatsApp president, see your class rep. Everyone else with name tags, please prepare to go down in 5 minutes. You have to be on the name tags to be identified there. Thank you.
So please, everyone else with a name tag, you can go down. Aside the students, everyone else with a name tag. What's up, President? What's up, President? Madam VP, where is she? What's up, President? Please go with your meal ticket to have a name tag. Go with your meal ticket, please. If you don't have a name tag, go with your meal ticket. If you don't have a name tag, go with your meal ticket. Please, all students, just hold on. Arrangement is the it's there. So if you don't have your name tags, other participants, take your ticket. Thank you. I want to thank all of us for staying on. We should resume the next session by 2 o'clock. Please, all those that haven't gone for the tea break, please go ahead. Aside the students, resume the next session at 2 o'clock, which is in 15 minutes. All those that haven't gone for the tea break, please do go ahead. We are resuming the next session at 2 o'clock. Session in a bit. Session in a bit. Please, those that have had their tea break, you can kindly come upstairs. If you have had your tea break, you can kindly come upstairs so that we'll begin the next session. We have the sub-team lecture, Community Dentistry, Public Health Services in a Developing Country, to be delivered by Professor Sonny Okeguna. We want to welcome the immediate past President General of the Densa Worldwide, consultant family dentist, Dr. Gabriel Ogbebo. You are welcome, sir. You're welcome, sir. Please, we're ready to start this session. The dean is around. All those outside, please come inside. All those outside, please come inside. We're ready to start this session. We're taking the second keynote, the sub-team lecture, and that's practically it. We give presentations for awards, and we'll be done here for today. So please, all those outside, come inside so that we can kickstart this session. We're ready to commence this session to take our sub-team lecture. With all those outside, and if you're done with your tea break, kindly come in so that we have this session run very quickly. All those outside, please come inside so that we have this session run very quickly. It's our sub-team lecture with the topic Community Dentistry, Public Health Services in a Developing Country. Community Dentistry, Public Health Services in a Developing Country. To be delivered by none other than the Professor of Community Dentistry and HOD Community Dentistry, UNIBEN, UBTH, Professor Sonny Okebeme. Let's put our hands together for him this afternoon. He's ably supported by his wife this afternoon. We have with us the HOD of Ophthalmology Department, UNIBEN, UBTH, Professor Mrs. Valentina Okebeme. Let's put our hands together for her. Now, please, you can stand to wave. We want to see you. Yes, that's Professor Sonny's wife. So, respectfully call Professor Sonny to take the podium. And then we are going to have the citation, introduction and citation of our sub-team speaker to be done by Fellow of Community Dentistry, Dr. Elomo Okwongai. Dr. Elomo Okwongai is joining us very shortly to give the citation for Professor Sonny Okebeme. Thank you, ma'am. We'll do some more acknowledgements after this sub-team lecture. Thank you all for staying on with us this long.
Good afternoon, everyone. Standing on the existing protocol, I'll be taking the citation for Professor Sonny Okebeme. Professor Sonny Okebeme is a professor of community and preventive dentistry, University of Benin. He's an honorary consultant, University of Benin Teaching Hospital. He hails from Emado, Ekpoma, Edo State, and attended Emado Primary School. He proceeded to the Federal Government College Warri, where he obtained his senior school certificates, and then he moved to the University of Benin for his bachelor's in dental surgery. He did his NYSC service at Ilorin and worked in Plateau and Nasarawa states as a dental practitioner. He did his residency training in community dentistry at the University of Benin Teaching Hospital and then joined the University of Benin as a lecturer. He is currently the head department of community dentistry, and he earlier served as the assistant dean of School of Dentistry, acting head of the then Department of Preventive Dentistry, and also served as the coordinator of the Dental Complex University of Benin Teaching Hospital. He also headed the Dental Surgery Technician Program as the coordinator in University of Benin Teaching Hospital. He is also currently the chairman of the Association of Dental Public Health Practitioners of Edo State. He's a board member, Faculty of Dental Surgery at the National Postgraduate Medical College of Nigeria. He's a past visiting scholar, University of Washington, and a recipient of research in Prevention Award at the International Association for Dental Research, ADRO. He enjoys gardening, earth sciences, and astronomy. He is married with children. Please, I present to you Professor Sonny Okebeme for his lecture.
Thank you very much. Thank you. Can I have the slides? I want to acknowledge the Dean of Dentistry for giving me this opportunity to present this lecture, the 10th annual guest lecture at the JUPSA, okay, John Odigwe Center. This is the 10th distinguished lecture series at the 14th annual scientific conference of the Alumni Union. Okay. Okay, so the content of this lecture will take this form. Okay, so I'll be very fast because of some things that are there. I'd like to dedicate this lecture to 3 persons. Professor Ejide, the pioneer dean of the School of Dentistry. He started the School of Dentistry in Benin. He's also started about 2 other dental schools in Africa, in Kenya, that's Makerere and University of Kenya. He's a man I had the opportunity to work with as a house officer. I learned one thing from him, and that is humility. I also dedicated to Professor Jeboda, the first professor of community dentistry in Nigeria, and also the first president of Association of Dental Public Health Practitioners in Nigeria. I learned from him simplicity. Last but not the least is Professor Mrs. Ueni, a focused female academic at the University of Benin. She's present here. I learned from her how to fight for what you want. She started this conference. She started the Alumni Association, and she started the splitting of the Department of Preventive Dentistry, and which metamorphosed into the Department of Community Dental Health, of which I am the first HOD today. Thank you very much, ma'am. So, as a preamble, I recognize that this is a public lecture, so I try to simplify it. So we look at the community dentistry's evolving role in Nigeria. It is really evolving. From the time that we started as students, things have changed remarkably. And I must, recognize the influence of Professor S.O. Jeboda, who was visiting professor to the University of Benin for 21 years before I came in. He trained me because there was nobody in Benin when I entered for training. So he trained me and taught me many things. My personal journey with him started as a student. While he's teaching, I'll be asking questions. And he said, I perceive you want to be a community dentist. I said, yes. From that student time, we developed a relationship that has lasted up till now. Also, we'll be discussing the scope of community dentistry as defined by the core curriculum minimal academic standards of the Nigeria University Commission. And then we'll also be looking at the influence of the National Postgraduate Medical College in developing the specialty of community dentistry. Now, what is community dentistry? Community dentistry is very often misunderstood by many people, including many of my colleagues. Let's even start from the name. We have multiplicity of names. We are called community oral health, preventing our community dentistry, public health dentistry, dental public health, and community dental health. All the same specialty. And even in Uniben UBTH, I have one name in Uniben, Department of Community Dental Health. Another name in UBTH, Department of Community Dentistry. So maybe with time we'll harmonize everything. So you can imagine that other people will find it difficult to understand what we are doing. And what this lecture is trying to do is to mainstream what we do and probably seek for people to understand what we are doing. Public health generally was defined by Charles Winslow in 1920 as the science and art of preventing disease, prolonging life, and promoting physical health and mental efficiency through organized community efforts. It's very important for us to know that it's a science and an art. And we are focused on prevention, prolonging life, and promoting health. Okay? And then through community efforts. And the core functions were defined by Institute of Medicine of the United States. This is a core group of elite scientists that come to discuss on issues regarding different aspects of the United States government. And the Institute of Medicine, they came up with regards to public health that it must be focused on assessment, policy development, and assurance. And this forms the core base of community dentistry. And I look at what body could do that in Nigeria. Okay, there's a group of Association of Medical Specialties that is coming up. They can look at issues that regards to health in Nigeria and see how they can come up with appropriate definition. With regards to public health milestones, we know the Amata Declaration in Russia in 1978 that defines public health, okay, and the core functions and components. I won't go much into that. The details of this are in the handbook, which will be distributed later on. Then also, with regards to health promotion, which is a core aspect of our practice, this was defined at the Ottawa chapter in Canada in 1986. And of course, the Sustainable Development Goals of the United Nations. We all work around all these milestones to bring up what we do in community dentistry. What are the characteristics of public health practice generally? It's a multidisciplinary foundation. So we do epidemiology, biostatistics, sociology, public health law, health economics, anthropology. You can summarize all these things into, social dentistry or behavioral sciences. So we go beyond just clinical practice to issues that are related to health and see how we can make things better for the community. Then we focus on prevention, community-based intervention, targeting marginalized populations, those that cannot receive dental care in the normal way. So we have to go out to meet them and create access for them to receive dental care. Then specifically, we'll be doing fluoride application, fluoride auxiliary application, training and capacity building of allied professions. You'll see that later on. So we have done something in UBT with regards to that. School dental health practices, dental screening, as we did yesterday, oral education, and then program administration. So we have different programs that we have started in UBTH, Uniben, and then we have to administer those programs as we move on. So it's very multidisciplinary. Sorry. Okay. Now let's look at public health, dental public health in Nigeria. So we look at training. So we are involved in training undergraduate and postgraduate resident doctors. And in Nigeria, this is going on very efficiently and smoothly. And dental public health is also working along that line. Then policy. Nigeria has an oral health policy. And the implementation is for all dental personnel. And we are focused on primary oral health services as defined by that policy. I will talk a little bit on that later on. Sorry, was Okay. Now, with regards to undergraduate training, we have a new curriculum. The curriculum defined for the undergraduate training was it is called NUC Core Curriculum Minimum Academic Standards. First, this transited from the benchmark minimum academic standard, BMAS, and this was concluded in 2022. It started in 2018 by development of a template for more universities, and then there was a core review group that works on that template for a year, ending in 2022. I was part of that core group that worked on that curriculum under the facilitatorship of Professor Kebukola, and then our group was led by Professor Nimi Briggs, the late Professor Nimi Briggs, and the dental core group was led by Professor Yitope Ogunbodede, the former Vice Chancellor of Obafemi Awolowo University. So I will focus on community dentistry. What is the curriculum for the training of undergraduates in community dentistry? This is a simplified version. You can see the courses, you can see the credits, and the course description. This is particular to University of Benin. There's 70% and a 30% addition. I was the chairman of the School of Dentistry Committee, CCMAS Committee, and then we have come up, and this is what we have focused, and this is what we are using to train our undergraduate students. So we are developing this. Then at the postgraduate level, the Faculty of Dental Surgery of the National Postgraduate Medical College has also developed a new curriculum for training undergraduates. And this was concluded in 2020. And you can see the specialty, the recognized specialties by the National Postgraduate Medical College. And of course, you can see community oral health there, which we are actually implementing in Benin. We are doing that efficiently. These are the specialties that are recognized. We are there. Now, with regards to oral health policy, Nigeria has an oral health policy. In fact, we've always had an oral health policy to some extent since 1984. But the problem has been implementation. But recently, that was December 2024, a new policy came out. And I think my former dean was represented there. And the problem has been that the dissemination and the awareness about this policy is very low. But basically, it talks about the situation analysis, which we have to assess. Professor Kufari was talking about having a database. You develop a database by having assessment. If you don't have assessment, you don't have records, then you cannot develop a database. And then you focus on prevention. So the policy defines for us that it should be an integrated policy with a universal health coverage, basic package of oral care in the workplaces and the schools, using the strategy of advocacy, health promotion, education, developing workforce capacity, that's the personnel, both for doctors and allied persons, building research, collaboration and partnership. We are doing that under the auspices of Association of Dental Public Health Practitioners of Nigeria and nationally. And in Edo State, yours sincerely is the chairman. We are the first state chapter in Nigeria to have this association. And we want to start collaborating with other people and other bodies. So integration of oral health in schools, pregnant people, adolescents, adults, and there's a role for academia. Academia should be involved in policy development. And I was very happy that when they were meeting in, I think it was KEFI, when the Nigeria Dental Association and the Intercountry Center for Oral Health was there and others, they were looking for, reaching out to academia. And I got a call from them that there was a paper I presented in Abuja in 2021 with regards to policy analysis, and that they wanted that paper. And I sent it to them. And they used it, and it's well documented in Nigeria Oral Health Policy 2024. Okay, and this is the new policy, and I've encouraged them to disseminate it to everywhere it is there. Now I want to look at Uniben UBTH community dentistry, the development. I will go a little bit into history. All these things are well documented. Now, the first community dentist in Uniben was Dr. Nunu, Dr. David Nunu. I don't know people that know him here. Some of you may have known him. I never met him. And Dr. Osuho, Dr. Anne Osuho, she's a white lady. She's a British woman. She's alive. She's living in Bristol. I was able to find out. I tried to reach out. And she's living in Bristol right now. She's over 80 now. Then, of course, I talked about the influence of Professor Jeboda. After Osuho left in 1985, Jeboda started coming as a visiting professor. And he kept coming until I took over from him, okay, as his staff in 2024. So when I took over from him, responsibilities were now on me to develop the unit into a department. We relocated to UBTH in 2008, and then my department, preventive dentistry, we shared 3 rooms, and all of us started operating from each of those rooms. And we have expanded our programs since then to outreach programs and then curriculum integration with the NUC and then with the National Postgraduate Medical College, so that at every stage I make sure that we are aligned with the curriculum of our supervisory body, NUC, NDCA, and other bodies. The community dentistry had never had any problem with accreditation. The only thing they will say, okay, you need more staff, you need more staff, you need more staff, but not with regards to any other thing. So the fellows that has actually be trained in the University of Benin Teaching Hospital, starting with Dr. Suo in 1982. She received her fellowship in 1982, and after that, there was a very long period. Then I came, I received my fellowship in 2006, and then we started the training. I trained Dr. Guano. He's the current dean of the School of Dentistry, University of Port Harcourt. And then he got a fellowship at the West African College of Surgeons. Then my next trainee was Dr. Unawehe, who received his fellowship in 2018. He's currently the Assistant Director of Inter-Country Center for Oral Health in Jos. He's here seated. So, and after that, we trained the very youngest in the family, and Dr. Enoho Okora. She has passed, and she will receive her fellowship at the convocation in September in Lagos in September. Dr. Enoho is also here. She's a consultant. So thank you very much. And she's going to receive that award. She's going to receive that fellowship along with an award for the best dissertation in community dentistry in Nigeria. So she will be receiving 2 awards. Then, if I were to give this lecture somewhere else, it will be, maybe if it's in China, they will speak Chinese. If it's in Korea, they will speak Korean. We are the only one that use English like that. So before I proceed, let me speak some of my. A normal I will explain. I mean, around one raise let's saw one. Some people understand it here. A big one, it's a very strong. And then Ajime that was me. So this is just to summarize some of the difficulties we had in trying to establish the foundation of Community Dentistry at the University of Benin and UBTH. What is our impact and outreach? I'll just take a view of what we started doing from 2021 to 2024. So we have been doing screening at outreaches, and we'll see the various ways we have. So we have screened about 19,326 clients in UBTH from 2011 to 2024. Then we have educated a population of 41,603 through a total number of outreaches put at 268. That's as at December 2024. We've done a lot within this year. And for screening, because we do a lot of screenings outside the hospital, then within the hospital, we do screening at the CDC, Centers for Disease Control. Every Friday, we go there and we do screening, which has come to a total of about 9,569 clients that we have done. And when you look at that, sorry. Okay, sorry. Okay. So let you go on. So, but we also carry out some services within the hospital. We have a clinic in the hospital called Preventive Basic Package of Oral Care. It is preventive, like somebody presented a paper, basic package of oral care. It has a component. In Nigeria, we have added scaling and polishing. Okay? But when we are in UBTH now, we removed oral urgent treatment because within the hospital, we have people that can do that. In oral surgery, they can do extraction. We don't want to replicate extraction and all that. But so these are the services that we give at our clinic, Preventive Basic Package Clinic. We'll talk about that. So, traumatic restoration, scaling and polishing, smoking cessation, and then blood control, topical fluoride application, and dietary counseling, and all that. So we do this on a regular basis every day with a consultant clinic on Thursday. Then with regards to our outreaches, we streamline our outreaches because we can't do everything at once. So we go for advocacy, we go for antenatal screening, we go to communities. Sometimes, rarely, we go to hospitals, orphanages, and schools. So this gives general overview. See, most of what we do is in the communities. That's a green aspect. Followed by schools. These are the two main ones. And then orphanages, we go there and then combine some other things like advocacy. So we have to reach out to various people in the Ministry of Health, Women Affairs, and all that in order to explain to them what we do. And at the CDC, this is a trend of what we have been seeing. CDC in UBTH, our relationship with CDC in UBTH started in 2013 when the CND accepted to incorporate us into the CDC program in 2013. And we work there with ophthalmology, eye and dental care on Fridays. So they do a lot of screening, and then we have incorporated oral health and then eye care. So if you look at the trend, the red are the females and then the blue are the males. Consistently, it's the females that we see more there. Okay? Another way to look at the trend is not very specific. You see there was a downturn until 2019, then it shot up again. And one of the things that the CND told me when I wanted to incorporate oral health, at that time, the price for CDC was 3,000 naira. I said, okay, we are going to introduce oral health. Can you make it 3,500? The CND said, no, it's not about money. We want people to come to the hospital. We want people to come to the hospital. Then if they find anything that they need to be taken, they can now move into the main hospital where they have a screen. So he did not increase the price. It remained 3,000 naira. And then later on, it moved to 5,000 naira. and now it is 10,000 naira. But that 10,000 naira, to do the test outside, it will be more than 200,000 naira or more. So the hospital has continued on this trend, and we do that on a regular basis. Next slide. Okay, now let's look at our programs. I'm talking about program administration. At this point in time, I have to be very specific and then show some pictures of those that have worked with me and what we do so that you see it practically. So, it's going up. No, it's not taking it up. Oh, sorry. Please, okay. Oh, it's on itself. It's moving on itself. I'm not moving it. There's something wrong with the. It's not moving itself. Okay. It's as if there's a virus. Just take it to programs. Okay. So our programs, we have rural oral health program. We have a clinic at the comprehensive health center at Udo, and that's a UBTH facility. It is owned by UBTH. It's a big facility, and then we have a clinic there. We have 2 dental chairs there now. One is mounted, and then so you can see the dental chair there, and then you can see some of us working there. I think that's Olamide. That looks like Olamide. So we go there all the time. The UBTA gives us a bus for the training of residents. We have everything that has to do with a clinic there. So we do full complement of dental services there. Full complement of dental services in that place. Then we also go for market outreaches. We do market. So we go there, we teach them about our health on a regular basis. In fact, while we are to do, we must go to the market. We divide ourselves into 3 teams. One goes to the market, one remains in the clinic, and then one goes to their primary care center. Those are the primary care center. They'll be receiving people that are coming. Those that need immediate care, they'll be referred from the market, and they will treat them. We'll just treat them there. So that's what we do for rural oral health. Then we also have centers now at Oluku Primary Care Center and Oroge Primary Care Center. These have been well developed by the state government. We are collaborating with them, the Edo State Primary Care Development Agency. We have a collaboration with them. We are there all the time on Tuesdays and on Wednesdays, and these are well documented. Then we have school oral health. That's not sincerely. In 2015, I was the chairman of the Nigeria Dental Association, and then I remember something. That's my primary school. That's where I first saw a professor in my life. In 1978, that was Professor Ambrose Ali. He came to my primary school while he was campaigning to be governor in 1979. And that's my first time of seeing a professor. And he showed us a clip of himself wearing white coat. I said, I want to be like this man. Subsequently, events passed, and I became a doctor. I said, now, I am the chairman of the Nigeria Dental Association. What will I do for my primary school? My primary school must benefit from what I'm doing. And then I took my team to that place. A full complement of my team. And these are the people that worked with me. It's supposed to go back. Sorry. Yes. Okay. Yes, let me be fast. We are just running. Okay, yes, I will do that. Yes, this is a full complement of my team, my executive members of the Nigeria Dental Association at that time. So they are here. They are big men now. So they know themselves. Next slide, please. Next slide. Just be fast. No, you are going back. You see, now you are doing the same thing I'm doing. Okay. This is the same group, but we have a larger group now, including the nurses and everybody. That's my primary school. Next slide. And then we also go to special needs schools and orphans. These are the Roma missions. Next slide, please. Then we work with a family nursing, diabetes support group. We go there first Thursday of every month to screen diabetic patients and educate them. Next slide, please. Then here, this is the CDC screening that goes on every Friday at UBTH in collaboration with community health. Next slide, please. And then here's our clinic, the basic package of rural care clinic in Dental Center UBTH, where we carry out other services, and then we also do training. Next slide. Yes, we got a donation of a mobile dental clinic. We have started using it as we go to schools and communities. That's also one of the communities we are treating them. Next slide. The same thing, we are also treating the people. We are creating access for them. Next slide. So we also are involved in allied training, and the pioneer coordinator of the School of Training Dental Surgery Technicians. So this is myself and them in Lagos to go and see the first group of licenses. And this group of people that we train, because we have 15 distinctions nationally, 15 distinctions. And we are very proud of them. Some of them are here. And lastly, my team that work with me. Next slide. This is my team with the former dean. Hello, the consultant now. Eric's, Rojola, and David with the former team at a function. Next slide. So in conclusion, I want to say that community dentistry is very vital to public health. And community curriculum changes has helped advance this specialty and its growth in Nigeria. At Uniben Dental School at UBTH, we are delivering on the mandate to engage and impact the community. Thank you very much.
Hold on, sir. Please, sir. That's a great lecture. A teacher of teachers. That was a brilliant lecture, and thank you for all that you do and your contributions to the profession. Distinguished guests, ladies and gentlemen, I now have the honor and privilege to call on the first female dean of the School of Dentistry, University of Benin, Professor Mrs. Alice Unenu, to present a plaque to our lecturer, Professor Okegeme. I'd like to also call to join our lecturer, the beautiful wife, the head of Department of Ophthalmology, Uniben UBTH, Professor Mrs. Valentina, to join her husband as he receives the plaque.
Good afternoon, ladies and gentlemen. I want to say it's a great delight and honor for me to be standing before this great audience to present this plaque to Dr. Professor Okegweme for two reasons. Number one, it is You know, when you are a mother or a father, you see your child and becoming so great, particularly in a public function. I'm sure you will understand what I'm talking about. Okay, of course, as you know, was my students at the undergraduate level and also at the postgraduate level. And so I worked with him, and I know him, and I know he knows me very well. So it is my honor to present to you, Professor Okebene, this award of honor as a substitute speaker for this August occasion at the 10th Distinguished Guest Lecturer and at the 14th Scientific Conference Alumni Reunion. You've done well from the beginning, and we are a living witness to your prowess and all the things you have done and you are still doing. So I want to congratulate you and your wife for being present today to receive this honor. Thank you very much.
I'd like to call on the host, the Dean of Dentistry, and other members of the high table. Please hold on to join them for a group photograph. I'd like to call on Professor Sadolo, Professor Eddie Ragbe to please join them as well. While they are doing that, we'd like to alert those who are winners of the Professor Obekwe Research and Professor Idia Izeyamu's award to please get ready. Dr. Ogodi, please. Paparazzis, are we good to go? All right. Official photographer, let's know when you are good. Thank you very much. Can we celebrate Professor Okebene and his beautiful wife? Thank you so much. I want to believe that we have the other set of awards ready. We will be having the next award. These ones will be for winners of the Professor Obekwe Research and Professor Izeyamu award for the best case reports and research in orthodontics. Distinguished guests, ladies and gentlemen, we are still right here at the John Odige Oyegu Public Service Academy for the 14th Annual Scientific Conference and 10th Distinguished Lecture Series, as well as the Alumni Reunion. I want to believe that we've been we have been duly fed and we have been enjoying the program, and I would like you to please sit back because the organizers have told us that there is another package, which is the lunch. So we are not going anywhere anytime soon. All right, I've just been informed that the results for the awards, they are still collating. So while we wait for them, I'd like to call on the DJ to please give us a musical interlude, and then we'll be right back for the next segment of the program. Thank you so much.
DJ, thank you. Okay, so we are making progress second session of the 10th annual scientific conference and alumni reunion, as well as the 10th distinguished lecture series of the School of Dentistry, University of Benin. And this is part of the final activities of the outgoing dean, Professor Idia Niboko Izeyam. Let's put our hands together for her. She'll be coming in on Monday in a new role and capacity as the 7th Chief Medical Director of the University of Benin Teaching Hospital, Benin City. The first female dentist, the first orthodontist, the first female ever, CMD in Nigeria. In Nigeria? Maybe not in Nigeria, but in South. Maybe not in South. But we recognize her as our own. Thank you, sir. All right, so we're going to go to some quick award presentations, and we're going to take them in phases. The first award presentation is going to be in memory of one of our former teachers, our former trainers, and a former professor, a professor of periodontology in the University of Benin and the University of Benin Teaching Hospital. At this point, I want to welcome 001. Professor Osaigi Akiombari, who's going to handle this presentation for us as we make progress. Thank you, sir. Usher, please help me with that stuff beside you. Yeah. Okay. So, Professor Kemba, please stand before we invite the winner of this award. There is a very special love letter that was written to the winner of the award. I don't know if criteria were well established, but the committee knows that they know the criteria with which they worked with to get the winner of this award. All right, and it's addressed on the School of Dentistry letterheaded, co-signed by Professor Idia Ize Iyamu as the Dean School of Dentistry and Professor Ozomene Ekwekwe as the chairman of the award committee. It's called the Professor Patrick Ojehano Award Committee, School of Dentistry, College of Medical Sciences, is dated 14th of August 2025. So I will read the letter and I'll call the winner when we're done. It says, congratulations, winner of the Professor Patrick Ojehano Award. We wish to congratulate you on emerging as the winner of the Professor Patrick Ojehano Award for the most dutiful clinician 2025. That's in UBTH. So the title of the award is Most Dutiful Clinician in UBTH 2025. Most dutiful, DUTIFUL, clinician. This is in recognition of your dedication to service and in delivering high quality care, ensuring patient health and satisfaction. This award was instituted by an alumnus, Dr. Kingsley Momodu. Let's celebrate Dr. Kingsley Momodu Kizo. And Dr. Kizo instituted this award in honor of Professor Patrick Imyosho Ojehano, who during his lifetime was a dutiful clinician. So to the winner, we say congratulations again. This is where they're supposed to give me soundtrack. And the winner of the most dutiful clinician. Okay. So Professor Sagi Akumbari will also speak to, give us a little, tell us a little about Professor Patrick Ojehano so that we understand and have a proper context of the presentation of the award. But I want to invite the winner of the award to come up and join us before Professor Akumbari does the needful. The winner of this award is going home with a plaque. Is going home with is it $100? $200. $200. And then maybe I'll take the person in my car home for safety reasons. For logistics, we transfer the person home for safety reasons. The winner of this award is Dr. Onyebuchi Anago. Dr. Onyebuchi Anago, please come up. Stand up. Congratulations. Congratulations. You deserve it. You deserve it. Yeah. Announcing the arrival of the Chief Medical Director, National Orthopedic Hospital, Benin, a proud dentist, Dr. Philip Ugodaga, former chairman, NMA Edo State, former president, ARD UBTH, Dr. Philip Ugodaga. You're welcome, sir. Professor Kamba, the floor is yours, sir.
Filippo, thank you very much.
I want to tell you a little bit about Professor Ojihano. He was in the pioneer class, and I'm very convinced his number should be around 007 or 008. He entered the School of Dentistry in 1977, direct entry, into 200 level, and graduated in 1982. Incidentally, we were classmates. We entered school the same day, graduated the same day, passed primaries the same day, passed patron the same day. He's been a very hardworking colleague. Unfortunately, we lost him about 2 years ago. Very hardworking, simple man. Ojana and I were opposite in the sense that he was the simple one and the hard one. He was a simple man in the sense that he cared for everybody, cared for every student. You understand? At times when we are writing requirements and all this, you see Ojana taking the simple side. You understand? So we miss him because we loved him. I personally missed him because till he died, I think I was one of the last few persons that saw him before he died. You understand? Because we were close friends. You understand? In the class, we have people we talk to. Then all these other kind of small gist. You understand the gist? So that was my guy. I missed him, and I'm very, very grateful to Dr. Kimo that I will share his prize for Professor Ojihano. Kimo has done very well for us. That we must know. So, Uchi, congratulations, as we usually call you. You are receiving your prize today. Where, Mama? So, on behalf of the School of Dentistry, I present this prize as the most dutiful clinician. Congratulations. In addition to the plaque, you have a $200 check. You understand? Congratulations. Once again, congratulations.
That's for.
They say 2-1. In party politics, you see chairman who money. Is the cash $200.
That's for being the most dutiful clinician in GBTH. Let's welcome the dean to please come up stage and join them for the group photograph.
Now, some people didn't know, but we now know that by Monday we will have 2 dental CMDs in Benin. So we want to invite Professor Dr. Philip Okodaga, CMD, NOHB, to join in this photograph as well.
Judging from the response from the audience, you can tell that truly Dr. Yebuchi earned this award. Can we give her another round of applause?
Okay, so we are going to have another set of awards, but before then, I want to respectfully invite the following people to go outside to be assessed for the scientific session oral presentations. Professor Messi Oko, to come out. Okay, to get ready. Okay, so please, the following people to get ready: Dr. Hope Osadiaye, Dr. Promise Okereke, Dr. Ukachi Nnawuye, Dr. Ella Okongai, and Dr. Promise Okereke. Four of you are to get ready, please. The assessors are Professor Mesioko and Dr. Harrison Omokwa. So please, we need those people also mentioned to get ready. Dr. Hope Osadiaye, Dr. Promise Okereke, Dr. Ukachi Nnawuye, Dr. Ella. We're going to give the next set of awards. So this award is Professor Idia Iyamu Award for Best Poster Presentation in Orthodontics. Professor Idia Iyamu Award for Best Poster Presentation in Orthodontics.
And to do us the honor of presenting this award, can we make welcome the Dean School of Basic Medical Sciences, Professor Osadolo. Can we celebrate him as he walks up the podium?
DSFBMS will present the award to the winner, who is Dr. Hope Esosa Osadiaye. 100,000 naira only. I'll take her home as well. I will take her home. I have enough vehicles to take her home. Good afternoon once again. We have the School of Dentistry, 14th Annual Scientific Conference, 10th Distinguished Lecture Series. I want to present this award to Professor Idia Iyamu. Best poster presentation in the orthodontics department. Congratulations. I'm sure you also have this takeaway, and it's my pleasure to present this to you also. You can come here, I will escort you home. Thank you so much, Dr. Sadalo. We appreciate that. Dr. Hope Sadalo, congratulations.
Thank you very much.
We will take you home, man.
The Professor Obwekwe Award is in two categories, and we have just done one. And now for the undergraduates, we're expecting the award for the undergraduate category. But if the undergraduate category is, if the award is not ready, to present for the undergraduate category, we'd like to call on Dr. A.B.I. Eroje to please step forward for the presentation. DJ, please give us some tunes while we await the award. While they are trying to sort out the awards for this category, Professor Obwekwe Research Award. Also, we'll be taking the Professor Iyamu Award for the best case reports orthodontics. Sorry. Please, Dr. Dave, please ensure The awards are ready. All right, we'll try and sort this out and then we'll be back. Thank you.
While we're waiting, we'll use this opportunity to take some more video messages which we couldn't entertain earlier. And I want to apologize profusely to take the video messages earlier. We are really pressed or constrained for time. Please, our sincere apologies. We have with us here Deputy Chairman, Edo NMO, Dr. Mohammed John Blaze, who is celebrating this afternoon. Thank you for joining us. We also have with us a distinguished dental entrepreneur and a benefactor of many. Ambassador Professor, it's collecting Professor very soon. Dr. Brightens Ogiroyi JP. Let's celebrate him this afternoon. Thank you for joining us. So quickly on goodwill messages, we want to take goodwill message from the Director of Dental Services. Director of Dental Services, please be prepared to give us a goodwill message. Yes, Director of Dental Services, we should heard. But before that, we also will be taking a goodwill message from the Chief Medical Director, National Orthopedic Hospital, Benin. Message from the Chief Medical Director, National Orthopedic Hospital, Benin, Consultant Oral and Maxillofacial Surgeon, Dr. Philip Ugodaga, former Chairman, NMA Edo State, former President, ARB-UBTH. Please permit me to stand on the protocol that was only established before I came in. I want to very sincerely apologize for coming in late. It's due to some mix-up in the schedule. I actually thought that this program and the alumni were one and the same, taking place tomorrow. So if I knew, I would never have faced the induction and training program for my new staff for today. It is while we were in the middle of the program that I got a message from Bongo, Harrison Moka. So, Chief, we are not here. I said, yeah. Aki also called me that, Chief, you are missing out. I said, yeah. They said that to John, you get, I said, is it not tomorrow? They said, no. So I had to stop the further training so that I can come and pay my respects, know that my teachers, in fact, my grand teachers are here. When I say my grand teachers, so many of them didn't teach me directly. They taught those who taught me. Thank you very much. So I'm a very proud dentist. If I had to go back to the university, I will read dentistry again. When I got admission to study dentistry in my year one, I was in the hostel, Hall 4, Unit 2, Room 107. And I was fortunate to have my classmates from year 1 till graduation is here, the immediate past dean of the Faculty of Dentistry, Dr. Professor Saru Omorige. Professor Kembali was reading out things here. How the survey started the same day. We entered the university the same day and we graduated the same day. I was fortunate in my first year to have a roommate who was a final year dental student, Dr. Godwin Igbojoba. I knew virtually nothing about dentistry. He's the one who told me, he took me to boxer meetings, he took me to the dental clinic to have my first S&P.
as a requirement it was for them. For those of us who know what requirement is in dentistry, I then rose to become president of BOTSA. And roll to today, this is not the day where we say the story. But I'm thankful to God and a lot of our colleagues that the dental profession today is a very graceful one. We are blessing the trail. How very many firsts. Certainly not the first to be first in this and first in that. The CMD of the Lagos University Teaching Hospital Roots is a dentist, a consultant oral and maxillofacial surgeon, and by God's special grace, I'm the first dentist to be CMD of an orthopedic hospital in Nigeria, the National Orthopedic Hospital, Benin City. As if that is not enough. Incoming. We have an incoming. She will not be the first dentist, she will be the first female Chief Medical Director of University of Benin Teaching Hospital. I take this opportunity to congratulate you, to say that because you are here to congratulate, I will say my senior colleague in the committee of CMDs. I know that Oga still get Oga. She's still Oga because she taught me. So congratulations, madam. Congratulations to all of us. Congratulations to the School of Dentistry for this. This started very many years ago. All of those who pioneered this, we congratulate all of you. And those who are continuing the tradition, I want to say that we will continue to support. We will hold very proud the banner of the dental profession everywhere we go, and to ensure that we will never, ever let you down. God bless all of us, and God bless the dental profession. Thank you very much.
Thank you, Dr. Philip Okodaga. I'd like to call back on stage the Dr. Hope Osadiaye. Please, yes, I'm calling her back. It's not easy to be the best in what you do. Dr. Hope is the best poster presenter in orthodontics, and she has another presentation here, Please, I'd like to call on the Dean, Professor Itia, to please help us with the presentation. Dr. Hope, please. Dean, ma'am. Please. Please, you have to help us with the presentation. Okay. The dean has asked that CMD to please present to Dr. Hope.
On behalf of the School of Dentistry Conference, I hereby present to you this Professor Udia Izeyamu Research Awards for the best poster presentation in orthodontics 2025. They are presented to Dr. Hope Osadiaye, the Deputy Professor. Congratulations. Congratulations. Before we move into scientific sessions, we want to take a good message from the Director of Dental Services, Ministry of Health, Edo State, consultant family dentist, Dr. Lucky Umanorene. Please just put a hand together for him. Please let's put our hands together till he gets here. Thank you. Dr. Brighton will give us the next video message. Just stand by. Permit me to stand on the existing protocol. I want to especially thank the dental families. A few days ago, I saw a video clip welcoming the incoming CMD back to Benin. And when I look at my colleagues, at my soon-to-be colleague, the student, and I said, here are the princes and princesses at the Duke of UBTH, because one of our own is now the Queen of UBTH. I never intended to become a dentist. My first choice was medicine, second choice was pharmacy. But in the process of looking for admission, I was teaching in the secondary school where I graduated from, Pepe Secondary School, Auchi. I was the best student in 1995. And the principal retained me because that school was started to be an art school, and said, if somebody can get 9/9 at the science student, you will be here until you gain admission to the university. And Mrs. E.M. Omokudu single-handedly through Professor Okamafe gave me admission to dentistry. So when I came in, it didn't go well with my family members. I was to write another job. So while I was preparing for the job in year 1, we had the boxer program at the banquet hall, the basement there. Then Professor Obekwe gave some presentation. I think then Ejiato was the boxer president then. He gave some lectures, and I saw what dentists could do in oral and maxillofacial surgery. I said, no, I will not write job again. I will not come back to 500 LT again. But that was in 1999. Something now happened in 2001. A relation of mine in Agenibode was involved in an accident, a fatal bike accident. So one of them died. She was referred from Lagos to Kaduna, and my immediate cousin took him to Kaduna, where he was operated by late Professor Adikeye. And they said the course were lucky they do. Now the man were treated lemon. Now he do. That was when my people appreciated dentistry. Thank God today we are where we are. And I can say I am not doing badly. I want to thank my teachers. I want to thank everybody who have made this journey very smooth. About 3 years ago was the first time I attended this scientific conference, not as a registered member, but to sign my book. I came to look for Professor Azodo to sign for me as my supervisor, and he asked me to sit down. I said, sir, he said, sit down. You go to dodge. You have to sit down and listen. And I listened, and I know that dentistry is doing a lot. Even in the simple things we think does not matters, because if you do anything that is not recorded,
it's like you have not done anything. Few weeks ago, I was at the Boxer Earth Week representing the permanent secretary that presented his keynote address. In that keynote address, I remember I made mention of the recent visit of the state NDA to the Honorable Commissioner of Health, Dr. Siri Adams Oshomole. The NDA is led by Professor Joan Enapulini here. I'm our vice chairman, state vice chairman. We saw the gap in oral health in our rural areas, most particularly in Edo North, where I happen to come from. At the state level, we have just 2 dentists, one in Auchi and one in Fuga, in the whole of Edo North. The oral health gap is enormous. When I was at Iwekwe General Hospital, a lot of people used to come all the way from Okwepe, Imeba, where I'm from, to locate me for treatment. At least they have one of their own closer home. But now, we don't have. And in that visit, the NDA passionately appealed to the state government that they have 2 universities who have the potentials to run a dental school. We know to run a dental school is very expensive, but we should not shy away from it. And he appealed to bridge the gap. If it would be possible for a dental school to be established at the Edo University in Yamo, we are appealing to the politically exposed among us to help us drive this home. If we have one there, we will be able to take our services down to the most neglected area in Edo State as far as oral health is concerned. Because in Edo Central, we have Otiwo there. At Ekpoma General Hospital at Iroepo, we have dentists in those places at Uromi. Even the one that was at Otuo in Edo North was transferred to Igwebe because there's no dental facility in Otuo General Hospital. But we have a facility in Igara and other things, but for logistic reason for the person, he has to be closer to Benin. So we are appealing. So I want to encourage us, especially the students, that dentistry is a fertile ground, a very fertile one. You are in the right place. And we want to appreciate our teachers who have always encouraged us, because in those days, we thought they were wicked. Azodo will be laughing with you. If I am going, as a junior resident, he will turn me. He knows that at 2, I will want to escape. He will turn me. If I am going, say, look, where are you going to? I say, I'm going for lunch. He say, clinic closed by 4. It is already 2 o'clock. Go to here, go and buy pero syrup and puff. Take it out. He will be laughing with you, but it means he's your friend, but he wants you to stay. And you know, all those discipline, when you leave and you not go for exam, and you write your exam like a test, you now know that you were well prepared. Thank you, and God bless us all.
Thank you, sir. Dr. Lucky Onanoreme from Imiegba in Edo North, Director Dental Services, first substantive Director Dental Services, Edo State Ministry of Health, Vice Chairman, Nigerian Dental Association, Edo State Chapter. Let's celebrate him. He's a consultant family dentist, so I think of that. Now, Dr. Lucky is a classical example of how to be a dentist. We now have a classical example of how not to be a dentist. Dr. Brighton, so you. Please come to the stage for your good message very quickly. Thank you, sir.
to stand on the existing protocol, and I want to appreciate the organizing committee chairman for this 14th alumni scientific conference and 10th distinguished alumni lecture series. And it's true, dentistry is one of the most interesting programs you can go through. But when dentistry go through you too. And you collect. Start to ask yourself, now this extraction, how you say how much? But you see, one of the good things in the profession is that it makes you stand out. And when you go into business and you tell somebody that you are a medical personnel, they have this level of respect they will give you. And you have that, they'll give you that benefit of the doubt, except you prove otherwise. And it gives opportunity for your business to thrive if you decide to do quality jobs at the end of the day. And I must say that going through dentistry was really very fascinating and very interesting. And the rigorous stress of going through dentistry gave me that opportunity to appreciate being an entrepreneur. And when I stop today, I will let you know that I started doing business when I was still in school. It didn't start after the practice. It didn't start. It was when I was still in school. So I just thought to myself, what can I do outside the dental clinic that can put me in the limelight, that can make me have my own dreams fulfilled? I had my own expectations and I know what I wanted. And I tried to find out from my senior colleagues what were their salaries, what they earn, and look at some of the cars and said to myself, if you want to drive this kind of motor, not be this type, not be here. But you see, it's interesting doing business, I must say. So business is the best thing I ever did for myself. But I will also tell you, there's nothing spoiled if you do your program like even when I don't practice. Or I can assure you that right from the inception of this program, championed by our former Dean School of Dentistry, Professor Mrs. Alice Remy, I have always attended every distinguished alumni series, every lecture. I have always attended all till date. And today I'm also the PRO of Budensa. So I'm not far from dentistry. Even if we don't practice dentistry, I'm not far from dentistry. And I must say, I will also use this to encourage the young ones that if you want to practice, it's a good thing. But if you can practice and still have a side hustle, it's the best thing. So I want to say thank you so much. God bless you all. And I want to encourage you to come for tomorrow alumni reunion lectures and series. I will appreciate you all to be there, and especially the Unibank alumni to be there for the elections we are hoping to have tomorrow to usher in the new schools. And please be part of the program for tomorrow. Thank you so much. God bless you.
Thank you, Ambassador, Prince Ambassador Dr. Brightens Ogienwoyi, JP, Senior JP, MD CEO, Brightens Electronics Limited. So we're going to continue with our set of awards presentations.
Thank you very much, Dr. Dave. For the Professor Obekwe Award, the undergraduate category, I now have the honor and privilege to bring again to this side of the auditorium, Dr. A.B. Oroje, to do us the honor of presenting the award. Please, let's clap for him as he steps up.
And the winner of the award is Dr. Charles Njoku. Please join us. Charles Njoku. We want to use this opportunity to thank profusely the judges for this awards, Professor Julie Omo, Professor Mika Dai, and Professor Eddie. I want to thank you and everyone that put in work to make sure we got the best out of this. Good afternoon, my colleagues. Okay. On behalf of the School of Dentistry, the College of Medical Science, University of Benin, I present this award to Dr. Charles, Professor Obekwe, undergraduate research competition, the best research contestants. Congratulations. Congratulations. Okay, our two CMDs are joining this picture. CMD incoming, UBTH, CMD, NOHB to join in for the pictures as well. We are going to take one more goodwill message before we do the postgraduate presentation. To give us that goodwill message, I want to respectfully invite, in the absence of our Budensa chair here, I want to invite a former Budensa chair, former Budensa president worldwide, Dr. Gabriel Obebo, to just greet us very quickly. Please let's put our hands together for Dr. Gabriel Obebo, consultant family dentist, former president Budensa worldwide, to give us a quick video greeting. Thank you, sir. My chief and trainer. Thank you very much. All protocols duly observed. Well, I'm so excited and elated of being here. And first and foremost, I want to dedicate this speech to Professor Mrs. Uweni. Why am I doing this? Because she saw tomorrow, which we are now celebrating today. And we keep on celebrating. She tells you to know that she's not an alumni of University of Benin. As she was dedicated. I remember when Maoga, sir, can I go on, sir? You know, we attended the same circle. You have been oppressing me from my mother's home. Professor Ahiobare. When is he? At the Shiva here. When she set it up, he was just interested in the progress of dentistry without any altar of self-benefit. And the greatest he achieved, which I'm happy about, was that before I left, I gave her an award, which is well deserved. I love my heart. And I want to say,
Dr. Budaga said she's a proud dentist. I'm a proud dentist. Why did I say Dr. Budaga say I'm a proud dentist and me myself I'm a proud dentist? We are both in NMA. And when we are in NMA, we don't disguise. We work NMA as a dentist. And by the grace of God, I've taken, apart from elective position, I was the medical editor, certified medical editor, the immediate past medical editor of Nigerian Medical Association. Which is, why am I saying this? Because in our time, when we entered dentistry, some of us, like what somebody said, we didn't know what is dentistry. I wanted to be a pharmacist because my father was like a helper. He had a lot of hair. So I felt when I'm there, I will be able to refine the hair. And the only thing that came in 1970, I left secondary school, ICC. I think they have Akoba. Are they here? That's a school. We should be grateful. I thank God. Poor man's child attended a rich man's school. ICC of those days. Then I was filling my form. I'm not a jambite anyway. I'm a concessional entrance man. We were the last concessional entrance in Uniben. That in 1977. JAM came in 1978. So we are not jambites. So I was filling my form. Imuse, if you know Colonel David Imuse, who wanted to be a dentist. Yes, he walked into my room because we are mates, classmates. In those days, not now. When you finish secondary school in those days, if your wife comes, we determine the kind of friends that you will have. There will be rearrangement. Anybody with grade 3 and SRO will not come close to you. That was the competition of those days. And we were not jealous of each other. He walked in. I said, Obes, what are you doing? I said, I'm filling my jam form. What do you want to do? I said, pharmacy. Well, pharmacy. Let's go and read dentistry. I didn't know what was even dentistry. If it's possible to bring out the form of that concessionaire, you will see many cancellation and reordering. But I know that though I didn't have it, I don't have an arterial open bite. So, and I grew up in Ogbe, Ezoti. When I used to pass through Central Hospital, there's a dental, you will see, dental was specialist hospital, not Central Hospital there, it was specialist hospital. So when we are going and passing through there to King Square, not Ring Road. In fact, it was public feet before it transformed into King Square before it came to that. That is Benin history anyway. So, and I remember that. And I now say, yes, I want to be, I now change. Then when we wrote the first, that concessional, those days when you write concessional trial, it's no joke. I was lucky, I passed. To the glory of God. Today, I have no regret whatsoever. I'm proud to be a dentist. This material open badge, I've used it to speak to governors, to presidents, even to you. When I was your worldwide, I'm speaking to you with it today. When I was doing as an adjunct lecturer, I entered, there was a stammerer in the class. And I said, my friend, you want to succeed, manage your stammering. Because you can't be a stammerer in your Viva. There are many challenges. And today, I met you somewhere, he's a dentist today. So, for the younger ones, I will talk more by the grace of God when we have our time tomorrow. This is scientific. And we just want to shed light. Some may not be there, but I encourage people to be there. This is the only time you can make. I came back from Mina yesterday. I stopped in Ekpoma. Today I drove down from Ekpoma because I don't want to miss this program. That's how. But by tomorrow, I will be earlier. Thank you. Ma, Dr. Mrs. Ize Iyang, Professor. I appreciate you, ma. You know, I say, you have given us future hope. You have given us hope and future hope. We now know a dentist can be anything in UBTH. Thank you very much. I love my heart for you, ma. Thank you, thank you, thank you.
Thank you, sir. That's immediate past Mensa Worldwide President, Dr. Gabriel Obebo, Dr. Osereme Gabriel Obebo. Hello. College of Family Dentistry, Faculty of Family Dentistry. Thank you, sir. We appreciate you one more time. We are going to take the next award, which is the Professor All
right. Thank you very much. Those were words of wisdom. Our elder, thank you so much. The next award is Professor Obekwe Award for the postgraduate category. And to present this award is no other, my mentor, Directorate of Alumni Relations, talking of Professor Eddie Elagbe. We have two Eddies in the house, so I was almost confusing Ikameno and Elagbe. And they are both men that I respect and have great honor for. So ladies and gentlemen, let's welcome him as he presents this award.
And the winner of the award is from the room, the person Senior Registrar, Pediatric Dentistry. Congratulations. Thank you. Hello. Our very distinguished personalities here present. I have the singular honor of being called upon to do this presentation of the Professor Obekwe Postgraduate Research Competition Award in foreign currency. $400 to our own Dr. Orero, who has won this award of excellence. Please let's join in congratulating her. Thank you. Congratulations on this. Okay, some pictures. about two dental CMDs. So Philip Obodaga was also previously CMD of Central Hospital in Benin. He's doing CMD twice. Too strong. Perfect. You know we're together. So, ladies and gentlemen, mine is not actually a good message as such, but more of solidarity presentation. And that is that the compare, when she invited me, of course, indicated I'm the current director of the Advancement and Alumni Relations Directorate of the University of Benin. And just to, by way of joining the last speaker, on encouraging all of us to try to continue to identify with our alumni anywhere we find ourselves. I want to, as I said yesterday, publicly again acknowledge the outgoing Dean of School of Dentistry, our own Professor Idea Ize-Yamu, because if we are to give awards, which we are likely to do, of the most dependent personality that has worked to advance the cause of the University of Benin via the Alumni Association, she stands out as the most qualified in that regard since I assumed that office. And just to add, when the presentations have been going on, I'll be hearing those that were classmates in 70, 70 something, 80 something, is that I'm standing also as an alumnus of the University of Benin, who, if care is not taken, I might be the oldest here present. And that is because I'm happy to announce I joined the University of Benin in 1975, and I actually finished in 1979. I joined lecturing in 1982, and it is by the special grace of God, being an active participant in the teaching of general studies, GST. If you ever took Nigerian peoples and culture, this is the man that taught you Nigerian peoples and culture. I greet you all. I wish you success with this. Thank you very much again. Thank you, Professor Eddie Eragbe. Who wouldn't know Professor Eddie Eragbe? You didn't do GST now. GST. Yes, 112. I think it's 112. 121. I think 122. 112. Okay, now 122. In our time, it's a 112. That's fine. All right, I want to thank you so much, sir. We will take one more goodwill message. With your permission, now, we will take one more goodwill message. And that is from page 2. Very short. 1 minute, very short. 1 minute, man. We want to take from the National NGO. National NGO. Mr. Janet here. Dr. Franklin Abdulime, consultant orthodontist, area specialist teaching hospital dental clinic, to give us a video message representing the Nigerian Dental Association National. Now, how it's going to go after this? We have the vote of thanks by Dr. Neka Chukuma, Associate Professor in Pediatric Dentistry, and then we will go for lunch. We will take a scientific session, okay? We'll take a scientific before we go for lunch. Okay, someone put the enemy, Dr. So, 2 different messages, one by NGO National, the second by NMA, represented by Dr. Owame John Blaze, Deputy Chairman, and then we'll take a bit of thanks by Dr. Neka Chukuma, Associate Professor, and then we would enter the scientific session, then we go for lunch. You know, today we decided to be here today, Nabi. We decided to be here today, so we are here today. National NGA, well done, sir. Thank you very much, Mr. MC. Permit me to align with all the protocols duly observed. I'm here in the capacity of the Nigerian Dental Association, but I'm also here in the capacity of the mentee, and as a member of this room, this is where I am. I'm an alumni, and also a student of the Dean of School of Dentistry, outgoing Dean and incoming Chief Medical Director. Yes. Okay, on behalf of the President of Nigerian Dental Association, Dr. Medom M. Elias, actually actively congratulated incoming Chief Medical Director of University of New Teaching Hospital. In fact, he called me specially and said, "Have you congratulated Professor Ibrahim?" And I said, "We have done that." He's actually close to what is happening in the system, and he has seen a lot of your work that has been done, Ma, and he's highly impressed. In fact, we had a meeting last night, late in the night, and we're already deliberating how that we're going to make her our special guest of honor. This is an underground discussion. So it shows that her name is backing up everywhere, at every corner. And I know when I come to meet her for that, she won't say otherwise. But looking at the School of Dentistry, she has done exceedingly more than what we ever expected. I believe in her though, because I always knew her as a mother and a teacher, and my very good mother and friend. I would add myself as a friend because she talks to me well and shares her thoughts with me. And there's no doubt we didn't expect anything less in what we are seeing today. I think this is one of the biggest gatherings I've seen in, I think, any medical gathering. I don't know how she has done this, but I know herself and the chairman of LOC have done a very great and wonderful job. We wish you the best, Ma. Thank you for what you have done for our school. It's our school. You are part of us, Ma. And thank you for what we are seeing, what we're expecting to happen in the University of Benin Teaching Hospital, and we wish you the very best. Thank you everyone for supporting her all through, and I know you will support her in the University of Benin Teaching Hospital. Thank you very much. Thank you, sir. Please let's celebrate the National Secretary of the Nigerian Dental Association, Dr. Franklin Abdulrahman. Dr. Franklin was trained by our dean as well. He's one of our mentees. Okay, so for the final goodwill message, the Nigerian Medical Association Edo State, here represented by a dentist as deputy chairman, Dr. Oame John Blaze, to give us a quick goodwill message from the chairman and members of the Nigerian Medical Association Edo State. Please let's put our hands together for him. Good evening, everyone. Please permit me to stand on the already established protocol. But while doing that, also allow me to acknowledge my teachers, my trainers, and my colleagues here. The chairman of the Nigerian Medical Association, Dr. Eustace, Oferale, sent his good message. He would have been here, but is currently out of the city on an assignment. So he reads his good message has been said today now. Let me just read it out to you. It's an immense honor to stand before you today to celebrate a remarkable milestone, the 10th anniversary of our distinguished lecture series here at the School of Dentistry, and 14th annual scientific conference of the Alumni, the Union of the School of Dentistry. Looking back over the past decade, it's truly inspiring to see how the series has grown from a fledgling idea into a cornerstone of our academic and professional lives. 10 years ago, the School of Dentistry University of Benin envisioned a platform, a forum where the brightest minds in dentistry could converge
where groundbreaking research could be shared, and where the next generation of dental professionals could be inspired. Today, as we mark this significant anniversary, I believe we not only met that vision, surpass it in many ways. Over 10 years, the School of Dentistry have had the privilege of hosting an incredible array of speakers from pioneering researchers who have reshaped our understanding of oral health, master clinicians who have perfected their craft, and visionary leaders who have guided the direction of our profession. Each lecturer has contributed immensely to the rich history of knowledge moving within these walls. They have challenged our assumptions, expanded our horizons, and provided invaluable insights that have undoubtedly influenced our practices and our perspectives. But this lecture series isn't just about the speakers. It's about all of us. It's about the vibrant community that gathers here, eager to learn, to discuss, and to grow. It's about the spirited debates, the insightful questions from our students, and the networking opportunities that have forged lasting professional relationships. It's about the continuous pursuit of excellence that define our school and our profession. As we look forward, the need for continued education and collaboration remains paramount. The field of dentistry is dynamic, constantly evolving with new technologies, techniques, and research findings. Our lecture series will continue to be a vital conduit for staying at the forefront of this advancement, ensuring that our graduates and our practicing professionals remain equipped with the most current knowledge and skills. I want to extend my deepest gratitude to everyone who has contributed to the success of this series over the past decade. To our distinguished lecturers for generously sharing their time and expertise, to the organizing committee whose dedication and hard work behind the scenes made each event seamless, to our faculty and staffs for their unwavering support, and most importantly to all of you, our attendees, for your enthusiasm, your engagement, and your commitment to lifelong learning. This 10th anniversary is not just a celebration of what we've achieved, it's a reaffirmation of our commitment to excellence in dental education and practice. May the next decade bring more profound insights, more inspiring speakers, and continued growth for our beloved School of Dentistry. We have already sent our congratulating message to the incoming CMD of UBTH, Professor Ida Isayamu. I will wish her a prosperous tenure. I will promise to partner and work with her to ensure her vision for a better welfare for doctors and staffs of UBTH is achieved effortlessly. Ego NMA is committed to sponsoring one of the awards in the next lecture series. So please, organizers, kindly reach out to us and we may be sponsored too. Long live the School of Dentistry, long live Bondensa, long live NDA, long live NMA. Thank you very much. Thank you, sir. Deputy Chairman, NMA Edo State, Dr. Uwame John Blaze. We're going to take the vote of thanks right away. But before then, I want to very quickly, with the permission of the Dean, appreciate several people that have been behind the scenes, and they have made it very colorful as well by what they're wearing. The academic staff of the School of Dentistry, because I want them to stand up wherever they are so that we celebrate them. Non-academic staff, sorry, I need to take lunch. Non-academic staff of the School of Dentistry, please let them stand so that we appreciate them. Thank you, ma'am. I also want us to appreciate our students. They have been here with us all the while. Let's appreciate them. You can stand, please. Just stand.
Our students will just stand so that we appreciate you. I think from 100 to 500 level. Thank you very much. Very specially, I also want to, with the permission of the Dean, I also want to acknowledge very specially the chairman of NDA Edo State, Professor Joan Enabulele. Let's appreciate her. Let's appreciate her. Let's appreciate her. I know why I'm saying it to. Let's appreciate her. Let's appreciate her. Thank you, ma. Please stand, ma. Thank you, ma. Thank you, ma. You want to greet us, ma? Thank you, ma. Let's come out to greet us. Thank you, ma. Female chairperson, Nigerian Dental Association, Edo State, Lizu. Professor of Restorative Dentistry, Joan Enabulele. Thank you, ma'am.
Let me align with the existing protocol, but before that, let me recognize my boss, my immediate boss, my dean, Professor Idia Yamu. It's been a wonderful 7 months working directly with a dean that knows what she wants and gets what she wants. You know, when you work with a woman whose spirit aligns with yours, things are seamless. This is the first time I've really worked closely with her. She's been my friend, but now she's my boss. And now she's moving to become my bigger boss. I happen to be in the first, happen to be a member of the second organizing committee led by Professor C.C. Azedo. So I can stand here and say I have attended all 14 scientific conferences. And we started the first lecture series, and that lecturer was my own madam. So when I have worked with women, I tell you, I'm women that know what they want and know how to get what they want. Today I stand as the first female Nigeria Dental Association chairman, not a chairperson, but a chairman. Because yes, I'm chairing the association, so it's not a chairperson, it's a chairman. Yes. That position is not about gender. That's what it is called. It's chairman. In the constitution of the Nigerian Dental Association, there is no space for chairperson. It is the chairman shall. So I am Madam Chairman. So I stand proudly because in my tenure, the Nigerian Dental Association Edo State chapter has produced the first female CMD. So whether you like it or not, it is my tenure. I didn't want to speak because I felt that without NDA, there are no dentists in this state. First and foremost, we are primarily dentists. Like others have said, I'm a very, very, not just proud dentist, a very, very proud dentist. I didn't set out to do dentistry, but if you ask me now to write JAM, my first choice will be dentistry. Second choice, dentistry. Third choice, dentistry. Fourth choice, dentistry. So if you are not a dentist, you are missing out. I'm married to a medical doctor, so I can tell you that if you are not a dentist, you are missing out. So the doctors, for me, they don't mean much. Sorry to the medical doctors in the house, but if you are not a dentist, you fall yeah, you die there, you don't know where. So it's actually my pleasure to stand today at this 14th scientific conference and 10th lecture series of the School of Dentistry. Dentistry has evolved even from my student days to my residency days, and now to my days as an academic. And I see a future where every dentist will be very proud, not to say I'm a doctor, but to say I'm a dentist. That's where we should be heading for. Because when somebody asks you, what do you do? First thing you say, I'm a doctor. No. What I say is, I am a dentist. That's where we should be heading for. So, Madam Dean, this is her last official assignment as the Dean. But she's still very much a dentist. She didn't read dentistry by mistake, like some of us. She actually wanted to read dentistry. So when you see the spirit, when you see the zeal, you know that the passion has always been there. So I implore all of us that please, she has raised the bar, and I hope that the next scientific conference will even be more colorful. I see the Dean of Basic Medical Sciences. He's been here all day. And I believe that he's enjoying himself. He doesn't even remember he has to go back to employer. So please, sir, are you sure you read dentistry? I know him personally. So when I looked and I saw he was, if you look around, others have gone. But he's still here, showing that there's something about dentistry that is still keeping him here. So don't worry, we'll give you direct entry for dentistry. I don't know if we still have the scientific conference. Are we still having it? Okay, there's still a session. So please, let's just relax. And I enjoy academic gatherings. So I believe that even though we are tired, our brains will be tickled when we hear some presentations. So continue to enjoy the conference. Thank you, and God bless us all. Long live Nigeria Dental Association. Long live the School of Dentistry. Long live University of Benin. Greatest Unibank! Articulate Unibank Unibank!
Thank you very much, ma'am. I want to one more time celebrate the chairman, Nigerian Dental Association, Edo State, first female chairman. Edo State, Professor John and Abulile. To interest you to note, and I'm just saying this in passing, do whatever you will with the information. She's the Assistant Dean, School of Dentistry, Unibank. Let's celebrate her, yes. So when she was saying she's working with Madam, you understand what she means. But very quickly before the vote of thanks, yes, Dr. Nika, you are here, but quickly.
All right, just before the vote of thanks, we'd like to quickly acknowledge the hard work and dedicated efforts of the local organizing committee. They've done so well. Can we put our hands together for them? That committee is led by Dr. Philip Ogodi. And on that team, we have Dr. Nneka Chukuma, Dr. Harrison Omokwa, Dr. Salwe Alta, Dr. Dixon Oko, Dr. Sereme Akigbeme, Dr. Eloha Okorai, Dr. Rosemary Abu Oko, Dr. Osaronse Akime, and Reverend Ogono as the secretary. Thank you all very much for a job well done. Can we have Dr. Nneka Chukuma for the vote of thanks?
Thank you very much. I would like to align with existing protocols. I'm here to give the vote of thanks, and I must say we've had an enjoyable day. Normally at conferences, by the time it's getting to past, we're on to the hall starts emptying, but not so here. It's still full, and we wish, on behalf of the local organizing committee, my chairman, with your kind permission, I would like to say thank you to all the principal officers, all members of staff, friends, invitees, our indefatigable non-academic staff, and our academic staff, friends, well-wishers, and our great students. Please, I want, where's Israel? Oh yeah? Those are... I like it whenever they do it. So Israel, 3 dozers for the School of Dentistry, 3 indigenous dozers for the School of Dentistry. Thank you very much. Would I say more? Thank you all so much for coming. Thank you for gracing this occasion, and thank you for all your support. We do not take your support for granted, for showing up, for being here with us, and for supporting us. We couldn't have done this without you. And God bless us all. But before I step down, we've heard so much about the person who started this scientific conference. That was in 2011, sorry. 2012, Professor Mrs. Alice Weni. I would like to tell you that she's taking a bow on the 7th of October, 2025. A goldfish has no hiding place, so she cannot go without us closing down the school. It cannot happen. They've come to know dentistry as we are today. So would we let our bright star leave this environment without this kind of noise? Or even more is not possible. So she's going out with a valedictory lecture on the 7th of October 2025. You are all invited. If you wish to send goodwill messages or any form of support or present to her, please reach out to me, the LOC chairman of that valedictory ceremony. Thank you all. God bless us all. Long live School of Dentistry, long live University of Benin, and long live Nigeria. God bless us all. Thank you very much.
Thank you very much, distinguished guests, ladies and gentlemen. It's been an honor being here today. With that vote of thanks, we conclude the opening ceremony of this event. Please, I'd like to inform us that, I'd like to inform us that there will be a scientific session for just 20 minutes after the national anthem and the Uniben anthem, and then we'll have our lunch for today. So, distinguished guests, ladies and gentlemen, it's been a pleasure being the anchor in company of Dr. Dave Ohiwere. My name again is Ehisume Iriamiator. So can we arise now? We'll take the Uniben anthem, and then we'll take the last stanza of the national anthem as our closing prayers for this section. Uniben anthem, please. Uniben anthem. Is the DJ ready?
All right, we crave your indulgence to just take your seats. We are going to the scientific session right away. I want to welcome Professor Mercy Oko, Dr. Harrison Omokwa, as we take this session in 20 minutes. By top of the hour, 5 p.m., we are all going down for our lunch and we'll be out of here. It is 4:30. By top of the hour, 5 p.m., we are leaving this place. Dr. Mercy Oko, Professor Mercy Oko, Coordinator Dental Complex, Professor of Oral Medicine, please come forward. Dr. Harrison Omokwa, Consultant Restorative Dentist, HOD Restorative Dentistry Department, to please come forward. Yes, please. And then the people that are giving, people that are involved, Dr. Roko Sadiaye, Dr. Promise Okereke, Dr. Okachimna Uwe, and Dr. Ella Okonga, please come forward very quickly. Presenters, please come forward. Dr. Roko Sadiaye, Dr. Okachimna Uwe, Dr. Promise Okereke, please come forward. Let's get this done in 30 minutes, in 20 minutes actually. Dr. Roko Sadiaye, if you are ready, you go first. Dr. Roko Sadiaye.
Good evening, everyone. Good evening, distinguished ladies and gentlemen. We are in the 5th scientific section, and we are going to make it very scientific. I want to appeal to the presenters, so please keep to time. It's already late, and we are very, very strong. So the first presentation will be by Dr. Hope Osadeye, and it's on the assessment of mothers' knowledge, attitudes, and practices towards treating in Uselu community and urban area of Benin City. Dr. Hope, please, you have 7 minutes. Good afternoon. Good afternoon,
Chairman, standing on the already established protocol. Good afternoon, Mr. Chairman. Standing on the already established and aligned protocol, I will be presenting this topic, assessment of mothers' knowledge, attitude and practices towards teaching in Uselu community and urban area of Benin City. These are the authors, and this is my outline. Teaching is described as an harmless, normal physiological phenomenon, and it's a term used to describe the emergence and eruption of the primary teeth. The appearance of the first tooth in the oral cavity of an infant is regarded as an important developmental milestone in the child's life and is associated with a lot of symptoms. However, sometimes this period in infants can be disturbing and distressing for both infants and mothers. Tooth eruption has, however, been held responsible for a variety of unrelated symptomatic manifestations. Studies have shown that parents or caregivers' understanding of belief and about teething have a profound impact on the clinical care of the child. So in addition, the tooth erupts at approximately 6 months of life. When the primary tooth erupts, a lot of things are happening. The protective maternal antibodies wane, exposing infants to the risk of infection. Furthermore, at this age, these children are known to put objects in their mouth to suit their itchy gum, and this phenomenon is known as mounting. So mounting can complicate the already susceptible immunity, especially in setting characterized, in a setting characterized by poor parental and environmental hygiene. Increasing the erroneous symptoms attributed to symptoms. However, these symptoms are attributed to teething, fever, diarrhea, and susceptibility to infection. So, unlike these symptoms, which may lead to dehydration and death in worst cases, what has been attributed to teething is actually swelling of the gingiva, slight increase in temperature, irritability, drooling, mounting, and sleep disturbances. So in many situations, parents use remedies without the advice of dental professionals, but based on inputs from community nurses, friends, mothers, and medical doctors. In a hospital-based study assessing the knowledge, attitude, and perception of doctors concerning teething, authors found out that a substantial number of doctors knew at least one associated symptom, and they were mainly from school. In another Nigerian study among mothers, fever, diarrhea, vomiting, and increased salivation was attributed to teething. The aim of this study was therefore to assess mothers' knowledge, attitude, and practices towards teething in the community and urban area of Benin City. Materials and methods. It was a descriptive cross-sectional study of 345 participants, which were mothers in the community, and it was a convenient sampling technique. The tool for data collection was a researcher-administered structured questionnaire. IBM IPSS version 23 was used for data analysis. So in the study, a total of 24 mothers participated. Majority of the mothers, 85.8%, were aware of teething, with 31.7% reporting the source of information as being from neighbors who are mothers. However, the maternal beliefs about these symptoms were fever, diarrhea, and irritability. About half of the respondents had a fair knowledge of teething. The attitude of the respondents revealed that just over half believe that teething is physiological, while 41.7% disagree that dentists are the best professionals to visit. Overall, 252 participants had a negative attitude towards teething. So this is the table showing the social demographic. Most of the respondents were married, and their religion was Christianity, and the highest level of education was secondary. The ethnic group, based on the region and the area, the Benin's were the highest, and the age of the sex of the child, the males were highest, and the age of the child in months, we had the 19 to 37 as being 19 to 36 months as being the highest. Then the mother's awareness and source of information. The highest source of information here was most of the mothers were aware, and their source of information was either from neighbors, which was the highest reported source. While the highest reported beliefs from mothers was fever, followed by diarrhea and irritability. For the social demographic and knowledge of mothers, the knowledge of teething frequency, those with the secondary level of information had
fair knowledge. So this is just a pie chart showing the knowledge score of the mothers, and then the attitude of the mothers towards teaching. A lot of them agree that teaching is a physiological process, and also we agree that doctors have a role to play in the management of the symptoms. However, the use of herbal mixture was one of the practices, and dentists were just about 75% of them believe that you should visit a dentist, and 18.3% of them believed in self-medication, while 25% of them believed in the use of teething syrup for relief of symptoms. For this is a pie chart showing the maternal attitude towards teething. Then for the practice, I already mentioned, most of the mothers believed in self-treatment. Okay, overall, the composite score for practice, most of the mothers had fair knowledge. So from the study, it's recommended that teaching should be prioritized as a public health program that will educate parents and doctors as well on teaching, and integration of teaching education into the antenatal and immunization clinics where most of these pregnant mothers will be visiting, especially in rural or underserved areas, or for less educated population, to be able to bridge the knowledge gap and reduce harmful practices. So it is a natural process and it creates discomfort as it has well been established. However, there are a lot of symptoms that will be occurring at the same time where the child is erupting the tooth, which can erroneously be believed for teething symptom. So to reduce maternal infant mortality mortality, it's important that they should be educated on what teething symptoms are and what is not. Thank you.
Thank you for that presentation. We'll take questions, please, at the end of these sessions. We call the next presenter, Dr. Promise Okereke. Dr. Promise Okereke is not here. Okay, well, let me just take the next.
The next presenter is Dr. Okachi Nawi. Is going to give us a presentation on the oral health status of inmates in a Nigerian prison. Please keep your time. It's 7 minutes, please.
Thank you. All right, I'm going to talk on oral health status of inmates in a Nigerian prison. These are the authors from the Intercountry Center for Oral Health for Africa, JOS. All right, there are over 81,000 inmates in Nigerian prisons at present, and reports indicate these inmates often live in deplorable conditions due to inadequate access to necessity of life. And these living conditions might predispose them to oral diseases. Despite their number and risk of oral disease, little information is known about their oral health status. So this study is basically done to contribute to available baseline data for oral health promotion activities. It is a descriptive cross-sectional study of 282 inmates in the JOS Correctional Center. Information on social demographics were obtained using interview administered questionnaire. Oral examination was carried out under natural elimination using mouth mirror, wooden spatula, and blunt explorer. Simplified oral hygiene index was used to grade the oral hygiene, and oral diseases were data on oral diseases were collected using the WHO oral health survey criteria. Ethical approval for this study was obtained from the JOS University Teaching Hospital Ethical Committee, and also approval from the State Controller of the Nigerian Correctional Service. So we have a male-female ratio of 1:11.8, slightly Muslim population, the age range 18 to 78 years, Oral hygiene was fair and poor in 7.5 and 92.5% of the sample, and evidence of periodontal disease we discovered that in 45.4% of the population, with 14.1% having severe chronic periodontitis. We had a prevalence of caries of 45%, and the DMFT PUFA index was 1.53 to 0.71, and there was no filling component contributing to the DMFT score. The participants with caries that was present, 86.6% of them have progressed to the sequelae of caries, which is pulpitis, apical periodontitis, and so this is a proportion, 86.6%, that is the proportionate distribution of the sequelae of caries in these inmates. Pericoronitis was found in 2.8% of the inmates, and tooth-wear lesions 9.6%. Traumatic dental injuries of the anterior segments, we have 8.2%, and 43.5% had evidence of proper necrosis out of this 8.2%. The prevalence of oral ulcers, candidiatis, oral leukoplakia, erythroplakia, leukoplakia is as displayed. Okay, majority of the participants have poor oral hygiene and is in agreement with previous studies in the same population. Of course, their poor living condition, neglect to oral hygiene may be probable reasons, but also we also felt that improper performance of oral cleaning may be a significant factor, as there is superficial mouth cleaning during ablution before prayers, and perceive that they felt that they were also cleaning the mouth, but it wasn't properly done. Nearly half of the sample had periodontal disease and caries, and a tenth of the population had periodontal disease that had severe chronic periodontitis, while over 3/4 of the population had caries that had presence of the sequelae of caries. This supports poor oral hygiene in this group and may indicate poor oral access to oral health care, as advanced periodontal disease and sequelae of caries are often associated with excruciating pain during oral function. The DMFT score is relatively lower than prior Nigerian studies, but however, similar observations were observed, especially with lack of uptake of preventive care. The presence of traumatic dental injuries and oral lesions were higher in other Nigerian groups, and calls for further evaluation of the lifestyle, living condition, and mental health of this group. In conclusion, the oral hygiene was common, and many suffer consequences of untreated caries and periodontal disease, and there is a need for access to oral health care with a bias for early preventive as well as evaluation of other determinants that might be needed for effective oral health promotion. These are my appreciation to the participants, and the study was funded by the Intercountry Center for and International Missions Opportunities. My references. Thank you so much.
Thank you, Dr. Ukachi, for keeping to time. Thank you so much. Now we invite Dr. Ella Okwonga. She's presenting impact of oral health education on oral hygiene status of institutionalized orphans and vulnerable children in Benin City. Dr. Ella, you have 7 minutes. Good afternoon, everyone. Standing on existing protocol, I'll be presenting the impact of oral health education on the oral hygiene status of institutionalized orphans and vulnerable children in Benin City. And those are the authors using this outline. As a way of introduction, we all know that oral health is important to our general well-being. And despite the significant gains in oral health in populations, but oral health is still a problem in our environments, for both developed and developing country. And of these groups, we have the orphans and vulnerable children. And these are persons that have lost both parents and they are facing material problems, health challenges, social problems, emotional problems. And these persons have a lot of challenges as regards their oral health and their general health. And research has shown that disparities in oral health status are even worse amongst these underserved persons. And the health of OBCs are particularly of interest because they are increasing in numbers with the common trend of kidnapping, terrorism, and all the suicide bombs and war. And with the increasing number of OBCs, the burden or treatment of these persons are also increasing. And the governments, especially in Africa, they are unable to meet the challenges that are associated with treatment of these persons. Hence, oral health education have been known to be a cost-effective way of improving the oral health of persons. And so we want to find out this oral health education that we are giving out, is it really working amongst this group of persons? Hence the study. So the aim of this study is to determine the impact of oral health education on the oral hygiene status of institutionalized orphans. And we're going to find this out by first determining the oral hygiene status, then we'll find out if oral health education is helpful in improving their oral hygiene. Study is a comparative study carried out on OBCs residing in orphanage homes in Benin City, and it was conducted between 2023 and 2024, December 2023. Ethical clearance was obtained from the University of Benin Teaching Hospital, and permissions to access these orphanage homes was gotten from the Ministry of Women's Affairs and Gender Issues, and also consent was obtained from the proprietaries of these homes. Then informed consent from the participants. The OBCs were grouped into intervention and control groups, and those between the ages of 7 to 15 years were included in the study. Interviewer administered questionnaires were used to obtain information on their social demographics, and oral examination was done and recorded using the Simplified Oral Hygiene Index. Oral health education was given to the intervention group only at baseline 1 month and 1 month for 2 consecutive months. Okay, then data was analyzed using IBM SPSS at a confidence interval of 95%, and p-value of less than 0.05 was considered significant. The result, a total of 203 OBCs consisting of 106 and 97 participants in intervention and control groups respectively, residing in 23 orphanage homes were repeated in the study. At baseline, majority of the study participants had fair oral hygiene scores. Comparing within each group, it was found out that there was statistically significant changes in the oral hygiene scores between the time points at between 0 and T1. 0 is baseline, then T1 is 1 month, T2 is the 2nd month, and T3 is the 3rd month. So there were statistically significant changes in the oral hygiene scores at this time point in the intervention group, while in the control group, there were statistically significant changes only between T0 and T1. In comparing between groups, there was no significant difference at T0 and T1, but as time went on, which is the 2nd and the 3rd month, it was found out that there was significant difference in their oral hygiene status. That is just showing a diagrammatic representation at different time points between the control and the intervention groups. Looking at the effect of oral health education on this on the oral hygiene status of this group, it was found out that there was significant reduction in the oral hygiene scores as the time increased and also between the groups. This just showing that from the result, the oral hygiene status of the study participant is fair, which is the status of study participant at baseline. This is in line with reports by Santos, Meski, and Ojano et al. In 2013, who also studied the oral hygiene status of infant simplicity. So this fair oral hygiene status will be due to limited oral availability of oral hygiene aids. The testing impacts of oral hygiene, oral education, oral hygiene status were also reported in study by Aspari et al. And Stern et al. In conclusion, oral health education had a significant impact on the oral hygiene status of overseas. Community-based oral health education programs for overseas should be championed, encouraged, supported, and scaled up to enhance improved oral hygiene status demonstrated in this study. Thank you.
Thank you, Dr. Eloho. I want to say a big thank you to all the presenters. So now we'll take questions and answers from the presenters. Please, the presenter should move forward, please. Dr. Eloho and co-presenter, please move forward.
So please, we take, for the sake of time, we take the question for each presenter. One question each for presenters. Any questions? Is it that we are in a hurry to? Thank you. There's one hand up. Dr. Ola. Any other? So that we just pick two, Dr. and the chairperson of this session, the Professor of Medicine. Any other one? So we have 3 questions. Please.
Thank you. My question goes to Dr. Alejo. I just want to know, thank you for your wonderful presentation. You didn't tell us the duration of this your research. You didn't tell us how long did it take you for this research. Thank you.
Dr. Elo, the duration of your research. You say you didn't mention the duration.
I did. It was conducted between December 2023 and May 2024. 6 months. 6 months duration. Yes.
A 6 months time frame.
Okay. Thank you very much. My question is to Dr. Just like a comment or a clarification. Part of the other thing is that was an erythroplakia and leukoplakia. That was to me like a one contact interaction with the So I was thinking how it's possible just that I want to establish a diagnosis of leukoplakia and erythroplakia, knowing that should have possibly taken a biopsy of patients and all of that. Thank you, sir.
Okay, we're fine. Any other question?
If it's a comment.
It's a comment, yeah.
That means he agrees.
So you agree?
According to the World Oral Health Organization Oral Health Survey criteria, all right, when you have such without any known cause, when you've seen such without any known cause, you classify them as that. Then you cannot do further investigations to really clear your doubt. But it's a field survey, and that's the minimum requirement for a field survey. Yes, thank you.
Okay, thank you, Dr. Ukachi. My question is actually for Dr. Ukachi. Just like Dr. Olamide, a senior registrar in medicine, was interested in that section of erythroplakia and what did you do another month? I wanted to ask that question, but I will just ask the first question. In your result, you said oral hygiene, poor oral hygiene was seen in 261 inmates. That's 92.5%, very high. And then you said oral ulcers was seen in 20.6%. And you know that poor oral hygiene is an indicator for oral squamous cell carcinoma. So were you interested in grouping the oral ulcers to see whether they were malignant or potentially malignant? Because you saw cases of erythroplakia, leukoplakia, which points to the fact that some of the cases were actually
let's see. Because when we do research, it's not only to find this, what did you do next? Now that you saw oral ulcers, leukoplegia, do you have, is there any plan B to assist those patients, knowing that many of them with time, in the next 1 or 2 years, if they are erythroplakia, they could turn malignant? Do you have option B for those inmates, or it wasn't just for the purpose of research? Do you have any plan intervention for them? Because research should be not only for presentation, but also for intervention. Thank you.
Thank you, ma, for that comment. The environment is really a highly restrictive one. If you would go to the media, that correctional facility had a prison break like 18 months ago. So time was of essence in really even getting approval and collecting data. But what we did was to make our findings clear to the prison authorities for the need to really open up the inmates for further studies, to really have more clarity on the issue that we found, and also the need for them to have access to oral healthcare services so that their oral disease burden would really be taken care of and controlled. So this is just the baseline for our health promotion activities to this population that is always neglected in the scheme of things with regards to oral health. But thank you, ma, for your wonderful observation.
Thank you for the response. We thank God for our brother that survived the prison break. While to carry out research, those inmates can be very ferocious. You know what I mean? But I think what Professor Oku was trying to say is that in the long, even if you don't go back, but at least inform the authorities that this is my fine day, and let's look for a way to work in that area to help the inmates. Thank you so much. In the absence of any other question, I think we'll bring this session to close. Thank you so much.
We just appreciate Professor Mercy Oko and Dr. Harrison Omokwa for coordinating this session. Thank you, sir. Thank you, ma'am. And thank you to our presenters, Dr. Ukachi Nawuye, Dr. Hubu Sajaye, and Dr. Olomo Okwonga. So we are closing now. Please, we are going to maintain the same order we did for the tea break, but this time it's going to be faster because we are just having takeaway packs for lunch. So we would allow members of the high table and distinguished guests. Okay, closing prayers. Okay. No, we're not coming back. All right, so we're going to have closing prayers, and the Dean has specially requested Professor Uwenu to take the closing prayers. I want to appreciate all of those that came very early here. There are some people that came early. Special mention, Dr. Anthony Osagona, consultant oral maxillofacial surgeon, and he was a past president of the Nigerian Dental Association of those states. I want to thank him very specially. My trainer and chief, Professor Adegola Isele, was here earlier as well, and we thank everyone for spending time. Yes, she's still here. She's my trainer, man. She's my personal trainer, man. So when?
Shall we rise to pray? Silence, please. Let us pray. Our Father and our God, we thank you for a day like this. We thank you for this conference. All of us are living witnesses of what you have done today. It's been a glorious day. Father, we are grateful in Jesus' name. We want to particularly thank you for the organizers, the LOC, and their team leader, the dean, for this well-organized program. We are grateful in Jesus' name. We thank you for all the presenters and the knowledge passed to us. The Lord, the essence of the conference will be achieved for more breakthroughs in dentistry as a career in Jesus' name. More importantly, even as we go home, you take us home safely. And tomorrow is another day. We are expecting to converge again. We ask that as we come with expectation, our expectation will not be dashed. Thank you, Father. Thank you, Son. Thank you, Holy Spirit. This we ask in Jesus' name.
Thank you so much, man. So please, I will respectfully ask that our members of the high table, professors, consultants, please, you can make your way downstairs. Please, let's hold on to that there's much orderly. Our dean will lead the delegation of members of the high table, professors, consultants. Please, let's go in that order. After that, everyone with a name tag. Please, the students, please wait. All students, please wait. Please, when we are done picking our food, there's a picture booth downstairs that you can take pictures. Please feel free. Please, let's not forget tomorrow's program holds here as well. Tomorrow is the alumni lecture, Healthy Smiles Ahead, Navigating Dental Insurance Together, to be delivered by Dr. Effie Festus. And then we'll have the alumni AGM, and then an elections is holding as well. Okay. Please, all students are waiting. All students are waiting, please. State Financial Secretary, Nigerian Medical Association. So I'll let I celebrate you, sir. I celebrate you. All our chief residents here, all our senior registrars, PG coordinator. I want to share from our 100,000 from me. Thank you, man. Our students are waiting. Please, if you have your tags, just or your meal tickets, just hold them. It's takeaway pack, so you just go, you take it. Thank you all for coming. Tomorrow is another day. Please help me here on time. Our students, you don't need to come tomorrow. Tomorrow is special.